Welcome to the 2021 South Carolina Legislative Black Caucus and Prisma Health Minority Health Summit, featuring SLCBC members, health organizations, professionals, and leaders from across the state, providing information and conversations focused on health issues impacting South Carolina's Black and minority communities. Coming up, panels on managing health disparities among South Carolina minority and rural communities, COVID-19 and mental health, what Black men need to know about their health, COVID-19 vaccinations, where are we now and where are we going? Sponsored in part by Grail, Healthy Blue, Blue Choice Health Plan of South Carolina, Pharma, South Carolina Optometric Physicians Association, and First Choice by Select Health of South Carolina. Post, share, and tag someone you know that needs information, resources, and advice, because this is a conversation you won't want to miss. But first, please welcome SCLBC Chair Representative Patricia M. Hannigan, followed by Representative Terry Alexander, and a message from title sponsor Prisma Health, CEO Mark Ohala.
Welcome to the 2021 South Carolina Legislative Black Caucus Minority Health Summit. My name is Representative Patricia Hannigan, and I represent South Carolina House District 54, which comprise Marlborough County, Darlington, and Chesterfield counties. I am honored to serve as chair of this historic organization that has been dedicated to advocating and fighting for the needs of Black and minority communities since its beginning in 1973. 2023 will be 50 years of service to this community. This year, we are pleased and honored to have Prisma Health as our title sponsor. Prisma is a shining example of the health and medical experts we are blessed to have in our state. The Legislative Black Caucus is proud to have their partnership to bring you this program that focuses on the most important things to each of us, our health. In addition, we thank our summit sponsors for supporting this event, and you will see their commitment to the health of South Carolinians throughout the next few hours. The COVID-19 pandemic has put health at the center of our focus within the South Carolina and across the nation. We have pulled together a great program with topics and panelists prepared to share some valuable information with you. I invite you to ask questions, take notes, and then take action for you and your family. And remember that your South Carolina Legislative Black Caucus is always here to serve you. And our doors and our ears are always open. Thank you for joining us. See you soon.
Hello, this is Reverend Terry Alexander, and I serve in the South Carolina General Assembly, representing House District 59, which includes Florence and Darlington counties. I'm proud again to have the honor of serving as the co-chair of this year's Minority Health Summit. It is often said that we take our health for granted, and that each of us should do more to maintain and improve our health. I truly believe healthy individuals equate to healthy communities. So with the outstanding individuals and organizations that you will see today, I know you'll be able to gain some powerful insight and information geared towards the health of you, your family, and your community. I welcome you to the 2021 South Carolina Legislative Black Caucus Minority Summit.
I'm Mark Ohala, President and CEO of Prisma Health. It is our privilege to be the title sponsor of the South Carolina Legislative Black Caucus Minority Health Summit. We appreciate the opportunity to talk with you about a variety of important topics impacting our state's minority and rural communities, including the COVID pandemic and its impact on mental and emotional health, managing health disparities, and what Black men need to know about their health. For more than 2 decades, Prisma Health has worked to improve the health and well-being of our communities, especially those populations in our service area who experience barriers to healthcare access. These barriers can create disparities in life expectancy, access to services and treatments, overall level of medical care, and other important quality outcomes. At Prisma Health, We have focused on the underserved, uninsured, and vulnerable individuals who need us the most. In recent years, our focus has expanded to include social determinants of health, including access to affordable housing, healthy food, convenient transportation, and needed medication. The COVID pandemic has further highlighted existing disparities and contributed to the isolation of those who are vulnerable and living with chronic illness. One solution we are using is our COVID-19 mobile health vaccination program. We target communities that are not being represented at our current vaccination sites and communities who are in a high social vulnerability index, which is defined by vaccine rates in designated zip codes and census tracts. The mobile units help us address barriers that make it difficult for those who are currently eligible to get vaccinated, and uses community-focused events by engaging community partners who can help reach out to residents via churches, community centers, schools, and other groups. By paying attention to these social issues, our goal is to help South Carolinians become physically, mentally, and emotionally healthy throughout the course of their lives. At Prisma Health, we are committed to continuing our successful partnerships with community organizations who share our goals, with legislative representatives, neighborhood associations, faith communities, schools, and with other community groups, so that together we can make a positive difference in the lives of those we serve. We hope you enjoy the summit. Thank you.
Thank you for joining us for the 2021 Minority Health Summit, sponsored by the South Carolina Legislative Black Caucus and Prisma Health. This annual event will bring together SLCBC members, health organizations, professionals, and leaders from across the state to provide information and conversation focused on health issues impacting South Carolina's Black and minority communities. Our first panel is Managing Health Disparities Among Minority and Rural Communities, featuring Dr. Ebony Hilton, a practicing physician and associate professor at the University of Virginia. Ebony also serves as medical director at Goodstock Consulting, LLC. In 2013, Dr. Hilton made history, becoming the first African-American woman anesthesiologist at MUSC and currently serves on the Board of Advocates at the College of Charleston. Dr. Patricia Witherspoon is a medical physician with Prisma Health, but also has served in a variety of roles throughout her tenure, including a member of the investigation team at the SC Rural Health Research Center and the Office of Rural Health Policy. Also a member of the SC Cardiovascular Task Force. Currently, she's the Director of Community Outreach and the senior member of the Quality Team, and since 2017 has been a consultant at the South Carolina Department of Health and Human Services. Deetra Matthews serves as the Government Relations Manager with the Conservation Voters of South Carolina. Board member with Prisma Health's Children's Hospital, she serves as an officer on the executive committee and as a member of its Champion Society. Anthony Jackson is the Chief Operating Officer at Roper St. Francis Healthcare. Prior to his current position, his career at Health South included leadership roles within the diagnostic, acute, and rehabilitation divisions, and served as the Executive Officer of Health South's Rehabilitation Hospital in Columbia, South Carolina. Today's co-moderator is South Carolina Representative Jermaine Johnson, elected to the South Carolina House of Representatives in 2020. Jermaine Johnson represents South Carolina District 80, covering Kershaw and Richland counties. Representative Johnson currently serves on the Rules and Medical, Military, Public, and Municipal Affairs Committees in the South Carolina House of Representatives. Please welcome our panelists for the Managing Health Disparities Among Minority and Rural Communities panel. Good morning, and thank you again so much for joining us. What I know is going to be a great conversation with so much great information. And because of that, we want you to post and share this information out. If you know someone that wants to know about this, and really that's everyone, as we are in the midst of this medical health pandemic, we need to get this information out. So please, as viewers, post and share. Good morning to our panelists. Thank you so much for joining us today.
Good morning.
Good morning. Good morning, everybody.
Good morning. Good morning. Well, listen, let's just jump into the conversation. Let's talk first disparities among both minority and rural communities. Let's talk about what are those disparities, the factors that contribute to them, and solutions for solving these challenges. Ebony, can we start with you, fresh out of surgery?
Thank y'all for having me, and I'm sorry for this look, but honestly, it's one of those things. We know that racial health disparities did not start with COVID-19. They won't finish with COVID-19. Literally, Black people, we had higher death rates for 9 of the 15 leading causes of death before COVID. That was cancer mortality, that was infant maternal mortality, neurovascular mortality. We literally are dying at younger ages and at higher rates, to the point that before COVID, our life expectancy was 5 to 10 years less than if we were white, right? And we know that socioeconomic status doesn't necessarily dictate, meaning that you can have you can have a higher educational attainment, you can have a higher income level, you can live in a quote unquote better neighborhood, and yet your outcomes are still worse if you're Black versus white. So we know there's many different factors that plays into that, from the individual, community, and the hospital perspective. But with COVID-19, it kind of accentuated that fact to the point that we're seeing Black people, we have higher death rates in every single age category, with the greatest disparities not being for our older population, but really that middle group, that 30 to 49 age group, where we're 5 to 8 times more likely to die from COVID than if we were white. And it's not only in terms of death, but also infections and hospitalization rates, because we know not everyone dies from COVID-19, but we know everyone that has COVID-19, there's at least 30% of those that will develop long hauler symptoms, right? And these chronic illnesses that we're now seeing.
Dr. Witherspoon, that's interesting that Ebony said it's that middle age, which I don't think middle age is really the middle of the ages. But why is it that particular demographic has a higher health disparity, particularly during COVID? Because I'm thinking that the ages that she's talking about, you're just living life and having a great time, not worrying about the high blood pressure, the diabetes, and things of that sort. Why that age group?
Well, it's interesting because what's happening is that chronologically they're in that middle age group. But when you think about the body itself, because it's been enduring so many other extraneous forces, that has a tendency to decrease our health. And so it may be chronologically 39 to 50, but maybe it might be that person may truly be having an age of a 40 to 60th individual because of it, because there's so many other factors that are contributing to the poor health. When you look at these groups, tendencies, when you look at all indices, even in cancer, they have a tendency to not only have the onset of diseases earlier, but then also with worse prognoses. Colon cancer comes to mind. And now with the new guidelines, they're suggesting maybe we should start screening African Americans at age 35, as opposed to waiting to the 40 or the 50. So right. When you put all that into factor, it may actually work out exactly how it should be. And it's wise for us to even recognize that it's earlier, as opposed to thinking that we're all going to have bad outcomes at age 65. And then we end up missing a lot. And so I think it's true to form with other chronic conditions as well as acute conditions.
Well, it's interesting, Ebony, because you also said that the factors that contribute to this are not necessarily your socioeconomic position, where you live, where you work. And we were always told that if we get a good education, if we live in the right place, then that makes it all things better. So what is it? What do we need to do?
Right. I mean, it's one of those things. For a tangent description, like my child is a double board certified anesthesiologist. I've literally trained 13 years after high school to earn those degrees, and yet my child is twice as likely to die than a white woman with a third grade education. That's just the truth of what it is. And so we know that there's things that happen within the hospital walls. We know about implicit and explicit bias. There's studies coming out of New York City, for instance, that showed that if Black people were actually admitted to the hospital, when we presented with symptoms of COVID-19 to the emergency department, if we actually were afforded the luxury of being admitted to the hospital, our mortality rate was actually better than if they were white, right? Meaning that if we were given that opportunity. But if you look at the Virginia Department of Health website, for instance, what they showed was that Black and Hispanic people were going and presenting to the emergency department more often with signs and symptoms of COVID-19, complaining that I cannot breathe. But when they look to see who actually got admitted to the hospital, white Americans were admitted more often. And does that difference in acceptance and admittance of care, what is the cost of that? And unfortunately, it costs us our lives. But we see the same thing with COVID testing early on, right? That the COVID testing units were in predominantly white communities. We see the same thing with vaccination. They're predominantly white communities. And even if you look at the criteria by which we allocate who is in phase 1A, phase 1B, right? If we look at that criteria, it is rooted in systemic racism, and that is pro-white in definition. Phase 1A was healthcare workers, of which 60% are white. Phase 1A was also nursing home residents, of which it costs money to put your family in there. 78% of all nursing home residents are white. Phase 1B, it initially started out with age of 75 and older, of which African Americans, our life expectancy is only 75. And even when they dropped it down to 65 and older, 77% of all Americans who live to see the age of 65 are white. If we go even to phase 1B, including essential workers, we know those are police officers, teachers, the people that have helped keep our nation afloat. And unfortunately, the majority of those persons in those professions are white. And by April 2020, less than 50% of all Black adults even had a job. So we tied vaccinations to age and to employment, of which we know Black people die at younger ages, and Black people are more likely to not have a job in the first place. So the policies by which we roll out these public health measures are literally rooted in a system that we have to break down from the ground up to build it back up, because it's not inclusive of the history that has shaped us. And unfortunately, what that has led to in COVID is that for Black men in particular, they lost 3 years of life expectancy in the first 6 months of 2020. And we actually had more people die in the later parts of 2020. So the life expectancy and the impact it's going to have on the Black and brown community is going to be tremendous.
Yeah. Dr. Johnson and Ms. Matthews, I want to get you in here in just a minute, but I want to play devil's advocate here because, Ebony, the way you broke it down, it does look like Black and brown folks were targeted. But let me ask this to you and Dr. Witherspoon. Was that not the right way to pull it out? I mean, didn't healthcare workers really need it? Didn't older people really need it? No?
Yeah, they did. And so I think it's retrospectively, I think we need a two-prong approach. Okay. Understanding what the impetus was, get those who are going to be face-to-face with this at a higher propensity, you want to have them covered. But if we then did a deeper dive, as Dr. Hilton is saying, he said, look, if you do that, who is in that category? We didn't bother to say who constitutes those individuals. We just went that everything is equal, but it wasn't. And it wasn't until after the fact that we realized, oh, wow, let's look at those in the health professions. Let's look at the educators. Let's look at the firefighters. And then systematically, a little bit late, we said, oh, that may not have been the best way. But I do believe if we're going to use the science, it was the best. But at the same time, concurrently, we should have also thought, but in that segment of minorities, how do we make sure they get into this first wave? But the problem with that is we saw, and I know you saw this in Virginia, when you did try to give vaccinations or testing in predominantly African-American areas, Caucasians went there too. Yeah. When the vaccine came out and all of their sites were taken, they started going to the Publix. I know heard about in Atlanta in predominantly African-American areas, because the question was, well, we hate for us to open up this vial and waste it. So at least someone's coming to obtain it. And that's where I think we weren't being honest and having enough trust in the process, that if we do allow those that we have shown to be more vulnerable, let them get ahead, there's going to be enough for everyone. But it was a panic. It was an absolute panic.
Yeah. And I would say even the panic, and I would say even in the panic, if we have a disease process that shows racial health disparities, and it has from the very beginning. I mean, initially, Black and brown people were 6 to 8 times more likely to die. And that was across the board for any age. If we're showing that we have a racial health disparities, then you can't have a race neutral policy of an intervention. Because if you have a race neutral policy and a racially targeted disease process, of which COVID does not care if you're Black, white, or indifferent, but the way the system of where you work, right? We know Black and brown people were only 1 in every 5 African Americans can work remotely from home, only 1 in every 6 Hispanic Americans. So they were forced to keep this nation afloat while everyone else was in the safety of their home and
Right.
working at Zoom. When we have these situations of where redlining has orchestrated our communities to be high density populations, and we say social distance, how am I going to social distance when there are 6 to 8 people living in my 2-bedroom home? I can't social distance, and I'm bringing that virus from my work as an essential worker in this grocery store or in the food supply chain straight into my home, and it's disseminated throughout my community. And that's what we saw with COVID-19. Now, that being the case, we then turned around and we know exactly where these outbreaks were happening. But when we came down to actually vaccinating people, we said, let's put it in the hospital and let's put it in pharmacies, of which we know that if you're in a Black and brown community, you're twice as likely to not have a hospital in your community. And that 70% of all drugstores are in predominantly white communities. And so based on, and then we can even go to how we said, let's register via internet. When we know our children have already showed us they couldn't do their homework in August because they didn't have internet access at home. So why would we 3 months later put this life-saving intervention on the internet for registration? So we had this racially targeted, or this racial health disparity disease process. We made a race-neutral vaccine allocation, phase 1A, phase 1B rollout, which made it, if it's race neutral, actually pro-white, and that's what we're seeing. It was pro-white. And then even the areas of location of where we're vaccinating people, the method by which we're registering people are all in a based on a system that is already pro-white in itself, right? If the pharmacies and the hospitals are in predominantly white communities, if the internet access is not in those Black and rural communities, then you are in a way of not meeting them where they are, you're targeting the most vulnerable persons.
Yeah. Prisma Health and the South Carolina Legislative Black Caucus present the 2021 Minority Health Summit. I'm Trey Taylor, your moderator for this morning. Dr. Ebony Hilton joins us. She is the Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia. Dr. Patricia Witherspoon with Prisma Health joins us. Also, Deetra Matthews, Government Relations Manager with Conservation Voters of South Carolina, and the co-moderator today is Dr. Jermaine Jackson. And Jermaine, I want to go to you because you represent a minority and a very rural community. Were you seeing these types of challenges, for lack of a better word, in your communities in the Hopkins area?
This is exactly what I'm saying down in our community. And it's even more difficult when we can't even get the hospitals to come down here to give out vaccines. And it's very difficult. So you've already got to deal with the lack of internet. Then you've got a lot of seniors that are living in these rural communities, like where we're at here, and no broadband. So they're trying to register on their phones or whatever they have, and you don't have service. And it was a lengthy process in the beginning. And from the very, very beginning, I was saying, well, how come we just don't have it opened up? Just let them come and get it, because everybody needs it. Just let them come get it, and they were making this process extremely difficult for people to get it. So, it's exactly what we're seeing in our area. I've been trying to work with MUSC. I've been trying to work with Prisma to get individuals down here to do it. But then the other part that we have to deal with is the trust factor. So, you have everything that Dr. Hilton said and Dr. Witherspoon said. But also, when we get the people down here, it's like, all right, well, are people going to show up and come to get this vaccine? Because rightfully so, the mistrust between the Black community and these hospitals and doctors for over century, I mean, it's just been bad, because of the things like the Tuskegee project. So, it's stuff like that we have to consider to figure out how we're going to reach the people that are in these communities.
So let me ask you, Jermaine, since you are an elected official and you do represent a community that is facing these challenges, what can elected leaders and healthcare professionals, ladies, including facilities, physicians, support entities, do to help these communities? Are we seeing a little bit happening now? What do you think, Jermaine, first?
Yeah, I think so. I just literally about 30 minutes ago, I saw a commercial come on TV from DHEC with Senator Daryl Jackson encouraging people to go ahead and get the vaccine and trying to reach out to people. So that's one of the things. I also didn't leave to go get the vaccine yet. I haven't went and got the vaccine yet because I was waiting to get the vaccine distributed in my community so that I could take the vaccine with my community members along with them. I didn't want them to see that I'm going to go outside somewhere else and do something different. I want them to know that I'm doing exactly what they're doing and I'm no better than they are. So, you know, when we get the vaccine down here, that's when I'm taking the vaccine with them. You know, I want them to see that we're all on the same page and we're on the same level and we can lead by example. You know, so some of the things that we need to work on is just by educating individuals and getting the proper information out. One of the things that I spoke with Dr. Bell about was about, you know, the rumors that this vaccine just came about. You know, we've had data on this vaccine for years. I mean, we've years and years and years that this thing has been around, but nobody knows that. People are just thinking that, you know, under the last administration that this vaccine just got developed in a few months. And that's not the case. We've got lots of data on this, and it is completely safe for us to go ahead and start administering it.
Well, you know what, Jermaine, I mean, you make so many great points, but I have to say, yes, the information maybe hasn't gotten out there because there is rampant misinformation. There's rampant misinformation in our community particularly. And, you know, I could do a whole show about the problem with that. But I will say we get our information from specific sources. Mm-hmm. You know, we're not watching CNN. We're not listening to NPR. So I am a big proponent of taking the information to where people are gathering information. So I have to say to you, I think a little bit the information is out there. This didn't just come about. And, you know, we've been medical professionals have been working on it because of SARS for years and years and years. I think the issue is, again, and I've said this before and I'll say it again, when in Rome, you have to do what Romans do. And in Black Rome, we need a different type of dissemination of information. Deetra, right. So how can we get these rural and minority communities, reach them when we've got, again, misinformation, lack of broadband internet, and so many other challenges that are facing Black and brown communities? What do we need to do to reach folk?
She's unmuted.
Can we get Deetra's mic unmuted, please?
Thank you. Thank you. Well, first and foremost, I would like to say thank you for allowing me to join this panel. Because I'm an environmentalist, and I hope to be able to speak about that a little bit more, because environmental issues are deeply connected to our public health. But and I want to go back to your question also, because I think I can tie it in together. Going back to how elected leaders and healthcare professionals, including facilities, physicians, and support entities, what they can do to help these communities. I truly believe that all of these communities have to work together. We have to build and nurture broad and deeply inclusive partnerships with our elected leaders. And that includes our physicians and so many support entities that are often our unsung heroes who are working in the community around the state of South Carolina. And so I also believe that we must recognize and embrace that it's going back to the environmental issues. It's not only human behavior that exacerbates the ever compounding issues that keep people of color from not being able to breathe clean air and drink safe water and live healthy and full lives. We truly have to meet people where they are. And I also believe that, and Dr. Jermaine Johnson knows because he sees me in the State House a lot, we have to allow more public input. Public input is so important. And I just have discovered that when you go into the communities that are suffering most, you have to go with an open heart and a listening ear. And while the solutions may not always be packaged in a nice and neat box with a bow on top, they are there. And so the solutions are in the communities.
Well, Deetra, thank you so much for bringing up the issue about environmental issues. So since you're talking, let's talk about, if we can unmute her mic again, let's talk about how the environmental issues affect us, Black and Brown people, in relation to this conversation and what needs to be done? What would you like to see as you advocate?
So there was an article published 2 days ago in the Washington Post that shared a recent study that shows that nearly every source of the nation's most pervasive and deadly air pollutant disproportionately affects Americans of color, regardless of their state or their income level. That study also showed that decisions made many, many years ago about where to build things like highways and industrial plants continue to impact the health of people of color still today. And so, and even with the country and the state of South Carolina making so many strides, Black, brown people are disproportionately shouldering the brunt of some of those environmental decisions. And so I would like to, this is one point that I think is often missing from some of the conversations. When we look at disparities, let's take energy burden in the state of South Carolina. South Carolinians pay some of the highest utility bills in the country. And this was pre-COVID. And now I do want to acknowledge that we all had to make hard pivots in our personal and professional lives when we were hit with this pandemic. But for so many South Carolinians, particularly communities of color, rural communities, and differently abled communities, those pivots were extremely traumatic and profoundly inequitable. And many South Carolinians, we've said before, were out of work. So that meant that people were having to use their air conditioners and power sources for heat and warmth. So while carbon emissions may have gone down for a lot of people because people were at home and traveling less, the energy burden and thus energy poverty increased. And so because of this, people were having to make very, very difficult and most often very unhelpful decisions. And so when you're looking at a $600 electric bill while not working, most often you're deciding between buying food or medicine or even paying the light bill. And we know that South Carolina summers, can be very, very brutal, and especially in July. And so, and I remember over the summer, there were stories where parents were giving their children sugary popsicles just to keep them cool so they wouldn't have to turn the air conditioner on. So during some of the hottest months. And so we know that can potentially usher in diseases like diabetes. And the doctors on the panel now can tell you that that's a disease that we certainly over-index in. And so I know I'm not trying to be very long, but the solution here, I think one of the biggest solutions is to really truly address energy poverty. And one of the ways to do that, we need to know the Black community, Black and Brown community, we need to know what our state's public service commissioners do. Representative Johnson, you know this. We need to know who they are. This is a government body appointed by our state's General Assembly. And these individuals, they decide how much we pay for electricity, what sources our electricity come from, whether a utility can shut off our power during a pandemic, whether there is a viable solar market in our state, the location of utility infrastructure, energy efficiency programs, and even whether we have options like local community solar programs. So I didn't mean to be long, but I'm so deeply passionate about this issue, and I just wanted include this topic into the discussion.
And I'm glad you did, Deidre, because it's important, because we hear about some of the other disparities that affect Black and Brown communities, but what you're talking about are things that are rarely ever not only discussed, even people are not made aware of. That's Deidre Matthews. She's Government Relations Manager with Conservation Voters of South Carolina. A little bit later on in the session, Deidre, I'd love for you to tell us a little bit more about your organization and what matters to you in the General Assembly. We're also joined by Representative Jermaine Johnson, also Dr. Patricia Witherspoon with Prisma Health, and Dr. Ebony Hilton, with Associate Professor Anesthesiology and Critical Care Medicine at the University of Virginia. I'm Trey Taylor. You are watching the South Carolina Legislative Black Caucus and Prisma Health Minority Health Summit. Please continue to post and share, and of course, ask your questions and make your comments as we continue talking about managing health disparities among minority and rural communities. So, Are there initiatives and efforts, Dr. Witherspoon, that your organization, Prisma Health, is doing to really focus on these challenges that Black and Brown folks are having?
Yes, and I'm glad. A couple things. I was listening to Representative Johnson talk about the Hopkins area, and so I'd be remiss to not state that yes, we definitely started off rocky in disseminating the vaccine, and with the leadership of Dr. Bell, we've been hearing the feedback and trying to make some inroads. And so Prisma, as well as the other hospital systems, have been making attempts, maybe not perfect, but making attempts to get out in the area with mobile clinics. They're using mobile units. They're trying to coordinate with the data to find out where we have issues of peaks and where we know there's been poor uptake in getting those vaccines. Like you said, Reverend Jackson made a plea. I understand the other Jackson of Bible for Brooklyn Baptist also made a big plea. And then I was really proud when the bishop of the AME had also coordinated with the hospital systems to being that face in front of individuals to say it's okay and welcome the parishioners into these different denominations and allowing them to have the vaccine disseminated. So the hospital is reaching out, better late than never, as well as trying to find modality. The issue I've heard that they've been up against is advertising, but then very few want to participate. I know Dr. Carrie Cease mentioned that in the upstate, that they're prepared to vaccinate 1,000 and only a couple hundred have decided to show up. So I think we have to re-pivot, like you state, trying a new modality of getting the information to the individuals, having people that look like us going out there saying it's okay, and just continue to answer questions. It may not be that we say it's fine and people just jump on the bandwagon. We may have to have different PR and different meeting people where they are to answer these questions so we can lessen that ambivalence. The other organization that I'm part of is the South Carolina Center for Rural and Primary Research, and I put that link up there. And this is an organization that has restarted through a proviso, through the legislation, trying to, again, meet people where they are. They're trying to find small areas because they have relationships with many of the primary care offices to provide the vaccine there and provide additional testing. And then the Office of Rural Health, that has been a long-standing institution here. It's a nonprofit in the state. And so when we look at individuals in the rural, they are integrating and intersecting with them already. So I think we have the organizations. We just have to do a better job of collaborating. And I promise I'm going to cut it off here. I think we need to take some advice from the ants. Several ants can lift a sugar cube. So if we really collaborate like we say we want to, we can do incredible things. One of the things that one of this organization I'm working with is the library system. When we talk about not having broadband, there are certain entities within these rural communities that have it. So maybe we think out the box and extend the hours in the library system, having an area designated that kids can come and do their homework, or maybe, lengthen the time at the school, providing resources at the school system. They have broadband. And then, of course, I always heard the story about the football coach that took his team after practice near the McDonald's because they had broadband and access to do their homework on the bus. So those are stories that illustrate how we can really be creative if we truly want to collaborate. Sorry.
Yeah, no, thank you, Dr. Witherspoon. I want to shift the conversation to some of the vaccines. But before we do that, I want to ask you, Dr. Hilton, are there initiatives that you're hearing of or that maybe you guys are doing in Virginia that could be advantageous to us here in South Carolina?
Yes, but they're not enough. The problem is with Black and Brown people, we're always given option B as an option, right? We always have these Brown versus Board of Education prove that separate but equal does not work, right? But yet, when we're looking at Black and Brown communities, we oftentimes say, and we applaud, and I am really grateful at the acute services that are offered to our communities and establishment of these vaccination clinics within churches and barbershops and schools, and being really creative and drawing in persons to get the word out. But what I would argue is that if you had to put a mobile clinic into my community, then when this pandemic is over and before it is actually over, I need to start seeing bricks being laid, because that means that there was no medical source within my community. And again, when we're talking about even broadband, we know now that health is directly tied to access, which is directly tied, unfortunately, to the internet. So we need to make permanent standings, and not just within the McDonald's and Taco Bell, because I don't want our community to be going to eat there, right? Right. But we need to start thinking even at the schools, because we know parents, unfortunately, Black and brown people, we have 2 and 3 jobs. I can't travel back and forth to the school to do this. Right. So how do we make this, establish this infrastructure within our communities at large? When, Deidre brought up a fantastic conversation about environmental racism, because environmental racism is real. And we have to think about, again, the impact of redlining on food deserts within our community, that we do just have Taco Bell, Burger King, and Hardee's, and we don't have a farmer's market or a Wegmans. The fact that if we're looking at even the industrialization, we can talk about Flint, Michigan with the water supply, but we can also talk about the air quality of Atlanta, Georgia. What industries are allowed to be planted in North Charleston that's not allowed to be planted in Mount Pleasant? Because we know there's a difference. We can talk about the impact that the lack of sidewalks even are green spaces within Black and brown communities. And we know that's directly linked to the influence of obesity, hypertension, and diabetes. We know all these things because people don't come to the hospital because they're feeling good. They come to the hospital because they're sick, which means that wellness happens actually outside of the hospital. Right. And how do we structure policies when Black and brown people are giving our tax-paying dollars? We pay taxes like everyone else. And we give our money to the system to say, here, create policies that are going to impact us all. Are those policies being graded along the lines of equity? Do we get the short end of the stick? Because I would argue that if there, again, is a need for a mobile clinic within my community, and we've known we had racial health disparities for literally generations, then why are we still struggling to get access? We have to make it at the foundation of our society. We have to start thinking about equity, and that's from education, housing, transportation, food and nutrition, health. Everything has to be revamped and looked at, and not to have a plan B option for people who are dying at higher rates and at younger ages. Right. Again, we're big people. Yeah. Yeah.
Well, that sounds like, Dr. Hilton, that's a question for Dr. Johnson, because that sounds like a legislative issue. Well, so, Dr. Johnson, we're all looking at you.
I always tell people health is political. And the sooner we realize that, the better we can actually help people to live a long, healthy life and not be doing amputations like I have to do this morning on a 30-year-old. We shouldn't be having that, right? But that's the reality of what we're facing.
Yeah. A lot of these things have to, you have to look at the different levels of government. And a lot of these things, are more on a more localized level in terms of, and that's one of the things we're dealing with right now in my community is the zoning and what they're allowing to come into our communities and what type of industry they're allowing to be put certain places. If you read recently in the state newspaper, I took a stand against that, and I asked for a call for Richland County to stop development and stop allowing this stuff to happen until they open the government back up to where people can come voice their concerns and opinions about what's going on in their community. These are things that have happened all across the state. And once I took that stand, I even had my Republican colleagues reaching out to me saying, hey, maybe we should sit down and talk about this because this is happening in my district as well. These things, they're just allowing things to go anywhere and everywhere. And obviously we know, they treat Black and brown communities like dumping grounds, like dumping communities, and say anything that they don't want to put in Wildwood or Shandon or one of these rich places or Mount Pleasant, anything they don't want to put there, they're going to put it in North Charleston. They're going to try to put it in Lower Richland. They're going to try to put it anywhere that they can do that. We've got so much environmental issues down here in my community that, people are just sick of it at this point. And it's becoming more noticeable because of this pandemic and development going up and things being closed down. And developers are pretty much taking advantage of the fact that people can't do the traditional pushback because of this pandemic. So some of these things, we have got the legislative way. I'm trying to figure out right now on a state level, what could we do to stop a lot of this stuff from happening? And I'm also been working with our county council members to figure out, what type of ordinances can be put in place to where they can stop this stuff. And they have to actually listen to the people that are in these communities that really care about their health.
Yeah. Thank you, Dr. Johnson. We've got 5 more minutes. I tell you, time flies when you're having a great conversation. So before we go, Deetra, I do want you to tell us a little bit about your organization, Conservation Voters of South Carolina, what you need from the General Assembly and what the public can do to help. If we can unmute her mic, please. Can we unmute? Go ahead.
Okay, thank you so much. And I'm so glad that the conversation it's ending this way when we're talking about environmental issues, because I'm so deeply passionate about it. And Dr. Johnson, Representative Johnson knows this. The Conservation Voters of South Carolina, we fight for clean air, clean water. We protect our state's land, and we do this through political action. And we are bipartisan, pragmatic organization. And I like to say that we advocate, we educate, and we hold our elected leaders accountable. And I just want to say, part of my job with Conservation Voters of South Carolina as their government relations manager, I'm the lobbyist for the organization as well. And so our lobby team has been meeting with our state leaders this legislative session, educating them on environmental issues and how they greatly impact the health and wellness of people in South Carolina. And so I'll say that we are either championing good environmental legislation, or sometimes we are fighting legislation that can put the health of children and their families in harm's way. And I'll tell you, we were just in one of the largest fights of this legislative session, because just like Representative Johnson alluded to, very often bad actors, bad polluting industries very often will go into Black and brown communities, and they sell it on economic development. And so and I just believe, and I'm sure Dr. Johnson, I'm sure everyone on this panel believes, no community should be sacrificed for economic gain. And so this legislative session, Conservation Voters, we've committed ourselves to being good allies in the environmental justice movement, because we recognize that the communities of color, we were first and most overwhelmingly impacted by COVID-19, and all while at the same time shouldering the brunt of the climate crisis. And so I think the gift of the pandemic has shown that very vividly, that communities that were hit especially hard by COVID-19 were often the communities that lack affordable health care, making them extremely vulnerable to toxic air pollutants. So I'm glad that we are ending the conversation talking about how environmental issues greatly impact our health.
Is there something the public can do?
So I can put in the chat my organization's website. Again, we are a political action organization, and so there are so many opportunities for you to use your voice, to get involved, and to hold our legislators accountable. We have an action center there. So we are advocating for clean air. We're advocating for clean water. We have pieces of legislation that sit in our legislature right now. This is the first year of the 2-year session. And so there's pieces of legislation that we're fighting, and there are pieces of legislation that we help craft, and certainly that we're promoting. So I'll put that link in the chat, and hopefully it'll be able to be shared with everybody. And please go there and take action and let your legislators know that you care about these issues.
Right. All right. That's Deetra Matthews. She is a government relations manager, Conservation Voters of South Carolina, and, if I can say, a candidate for Columbia City Council. Good luck to you. Also, Dr. Patricia Witherspoon with Prisma Health. Also, Jermaine Johnson, Representative Jermaine Johnson, Dr. Jermaine Johnson, if you're nasty, if I can do a Janet Jackson. I'm sorry, I'm dating myself. And the beautiful, talented, smart, rebellious, and very outspoken Dr. Ebony, she knew that was her. Dr. Ebony Hilton, Associate Professor of Anesthesiology and Critical Care Medicine, University of Virginia. Thank you all so much for joining us, for being passionate, open, and honest, and very frank about the conversation today, and continue to use your voices and your platforms to help Black and brown communities. You're watching the South Carolina Legislative Black Caucus. Prisma Health presents the 2021 Minority Health Summit. I'm Trey Taylor. Coming back, we're going to talk about COVID and mental health. That's next.
So it's hard to believe that about a year ago, the WHO declared COVID-19 a pandemic. Unfortunately, we've had 500,000 Americans die from this dreaded disease. We all know someone who's been touched. And I can't tell you how proud I am of the thousands of researchers who've been working 24/7 in our industry to try to change the course of this disease. And it's just remarkable to watch today as we see these first vaccines coming online, where we now have over 300 million doses that have been administered in over 110 countries. These researchers are able to see, their brothers, their sister, their mother, their father, their grandfather, their grandmother being inoculated with a life-saving vaccine. And it really has been, I think, the industry's finest hour. And as we look ahead, we think we can lever the strength of this industry to make more positive change and address dreaded diseases that are affecting our society.
What if in the fight against cancer, we had a powerful new technology? A new way to find cancer so it can be treated early. Cancer strikes about 1 in 3 women and 1 in 2 men in their lifetimes in the United States. Nearly half of those cancers will be diagnosed after the cancer has spread. Only 20% of people with late-stage diagnosis will survive 5 years. Important progress has been made in essential life-saving single cancer screenings, but early detection technology only exists for a few cancers. This means most cancer diagnoses simply arrive too late. So to help current and future treatments be more effective, you first need to know you have cancer as early as possible. And at Grail, this is our focus: early cancer detection. Grail's Gallery test is a significant leap forward in the war on cancer and a breakthrough approach to cancer screening. Instead of looking for cancer one at a time, organ by organ, the Gallery test has shown the ability to take a patient's blood sample, applying the latest in technology, driven by genomics, machine learning, and large-scale clinical studies, and identify over 50 different cancers. And if one is present, predict its location with high accuracy. Equipped with this powerful information, doctors have an opportunity to step in and act decisively, potentially before cancer has a chance to spread.
So
it's time to complement existing screenings and start looking beyond a small number of individual cancers. Because the most important cancer is the one you or your loved one has, and beating it starts with knowing you have it. Grail, early detection for multiple cancers.
I know it's not a great joke, y'all, but anyway, somebody else said it.
I love it. I love it. And Dr. Bustle, so good to see you again.
Good to see you too.
So tell me again, oddity?
Oddity, you got it.
I got it.
Yes.
With our mobile vaccine program, we want to bring the vaccine to the community. We realize that there have been a lot of barriers in getting access to the vaccine, mostly through email, digital literacy. And so we want to be able to bring the vaccine out to our community.
So I'm going to go ahead and put the slate up,
to get people registered and on site so that they can get vaccinated.
Our efforts are not to exactly be a mass vaccination site, but to come out to the community where we have vulnerable communities that may not have access or the ability to get to our larger sites, and really tailor to that group and bringing the vaccine to the neighborhoods.
Well, my grandmother is 95 years old, and she's been wanting to get the vaccine. And today it was a pleasure for me to bring her here so she could get the vaccine in her local community.
I learned about the vaccine from my manager of the wellness center in Eastover. I tell them, if it's going to help them, you go get it.
David.
Everybody's supposed to get it.
So we are super excited.
Somebody just called me and said that they can hear everything that we're
7
saying
mobile
backstage.
units in our Prisma Health fleet, and that will help us to really get out to all parts of our community so that we can bring the life-saving vaccine to everybody.
So I'm not sure how that. Okay, we're getting ready to begin right now.
Welcome back to the South Carolina Legislative Black Caucus and Prisma Health 2021 Minority Health Summit, bringing together SLCBC members, health organizations, professionals, and leaders from across the state to provide information and conversations focused on health issues impacting South Carolina's Black and minority communities. Our second panel, COVID and mental health, featuring Dr. Kenneth Rogers, who serves as the State Director for the South Carolina Department of Mental Health and selected by the South Carolina Mental Health Commission to lead the department in 2020. Dr. Rogers is also board certified in both general and child psychiatrics. Dr. Aditi Bustles is the Director of Research at Children's Trust of South Carolina. Through Mixed Methods Research, Dr. Bustles explores the ways public health policies, systems, and programs serving families can be more equitable and promote child health and well-being. Dr. Bustles is also named one of the best and brightest under 35 by Columbia Business Monthly. Dr. April Scott is an Associate Director of Mental Health Initiatives at South Carolina University. The therapist and consultant is dedicated to positive mental health and suicide prevention through outreach, education, and policy. Dr. Edward T. Lewis is a clinical assistant professor of psychiatry at the Medical University of South Carolina. He's currently the attending physician on the Addiction Inpatient Unit at the MUSC Institute of Psychiatry. Dr. Lewis also serves as the president of the South Carolina Psychiatric Association and has been recognized as an expert witness in forensic psychiatry by the South Carolina Court of General Sessions. Kenneth Myers Sr. is a community healthcare nurse for the Assertive Community Treatment ACT team with Prisma Health. With over 35 years in his nursing career, Mr. Myers currently serves the homeless population in Columbia, South Carolina. Mr. Myers is also a trustee on the Spartanburg County District 7 School Board and also serves on the board of the City of Spartanburg Civil Service Commission. The co-moderator for this session is Senator Ronnie Sapp. Elected to the South Carolina Senate in 2014, he represents District 32, covering Berkeley, Florence, Georgetown, Horry, and Williamsburg counties. Prior to serving in the Senate, he served in the South Carolina House from 2010 to 2014. He currently serves on the Judiciary, Rules, Transportation, Labor, Commerce, and Industry, as well as the Agriculture and Natural Resource Committee in the Senate. Please welcome the panelists for Session 2, COVID and Mental Health.
Afternoon and welcome once again. The South Carolina Legislative Black Caucus and Prisma Health present the 2021 Minority Health Summit. I'm Trey Taylor, your co-moderator, along with Representative Sapp. Thank you so much, all of you, for joining us today. I hear a little bit of feedback. I'm not quite sure where it's coming from, but if we can make sure all of our panelists have either earbuds in or their volume down, that would be great. Let's start the conversation. Each of you have medical expertise and specialty, and you have seen this pandemic. You're living it, and it's affected much of the American population on some level. So let's talk about some of the ways people have been impacted and how it's taken a toll on their mental health. We can start with you, Dr. Bustles. You're still muted. Go ahead.
Sorry about that. You would think that we've been remote for so long that we'd get this, but always seems to be an issue. Thank you all for having me today and to be with all of these amazing people on this panel. I have been looking at the pandemic in terms of its unintended consequences. So our area of passion and expertise at the Children's Trust of South Carolina is preventing abuse and neglect. And we know that that doesn't happen in silos. We have to promote those good things in order for us to see well-being and flourishing and resilience of our children and families. And when we look at the unintended consequences, it goes back to the conversation of systemic inequities and structural racism. When we look at the very beginning, the families that were the most impacted were typically families that came from communities that were under-resourced or historically disadvantaged. They were more likely to be essential workers. They were more likely to live in multi-generational homes. They were more likely not to have broadband access. And you can see how all of these then can compound to increased stressors, or in our world, what we call toxic stress, which is not the type of stress when you're preparing for a presentation like this, but the type of stress that's so unrelenting that it can change a kid's brain chemistry and lead to some trouble with social emotional development. And then we all know when that happens, there can be a higher risk for health problems. And so I challenge everyone watching today to think about the effects of the pandemic in terms of what we call the social determinants of health. Look at it in terms of how employment structures changed, how education and the quality and access changed, how access to healthcare and who got healthcare changed, and what were the new stressors that were simply related specifically to the pandemic, but then what were the stressors that already existed but were exacerbated by the fact that we were now dealing with something we had never dealt with before?
Yeah, thank you, Dr. Bustles. I want to go to you, Dr. Kenneth Myers, Senior, Assertive Community Treatment Act, Prisma Health. What about those who face financial hardships? Because I want to talk about the different facets of people that were affected and how they were affected. So let's talk about that. People who face financial hardships, income, job security, things of that sort. Dr. Lewis?
Hi, yes. So I'm happy to speak about this. And so in my work at the Medical University on the inpatient wards, certainly we're seeing how COVID has negatively impacted the mental health of the patients that I'm serving. And it has really increased the stress, as Dr. Bustles was saying, of an already stressed population. And so in particular on the addictions unit where I work and I serve patients who are struggling with substance use related issues, there have been a real access to care issues, and some of the services that we typically refer our patients to have had to reduce the number of beds that are available at sober living communities and residential resources that we use. And then the family members who have generally been able to step up and help their loved ones who are struggling with either mental health or substance use issues are more reluctant to do so out of fear of COVID and fear that they'll have a loved one come into the home and spread COVID to them after either being in the hospital or relapsing and being away for a period of time and then coming home. And so it's created a severe and acute sense of anxiety and panic, not only for the patients that we serve, but for their families. And I just want to echo what Dr. Bustles said. This all occurred on a backdrop of lingering and well-established disparities in terms of mental health care and access to care for our minority populations. And so it is echoed and amplified now due to the pandemic.
Thank you. I want to recognize Senator Ronnie Sabb. I think I said Representative Ronnie Sabb, so I wanted to recognize Senator Ronnie Sabb. I apologize, Senator Sabb. And again, please feel free to jump in the conversation at any point as co-moderator. Let's talk about some folks that have had to work from home, because that again was another facet of the population that very likely was affected as far as their mental health was concerned. You're having to work from home, and you're having to work and juggle, because kids were out of school also, everything that home has to have, you have to deal with at home. Dr. Rogers, can you chime in on that?
Sure. This is one that's near and dear to my heart. As a state agency director, we have about 6,300 employees and contractors working with us. And so as we were coming into the beginning of the pandemic, one of the things that became clear is that we really couldn't be in our offices. So about 50% of our employees were at home. There were a number of stressors that were created. The first is, do you have the equipment to actually work at home? And so for a little while, people were like, how do I make this adjustment to being there? The second thing that came up was, my kids are now home every day. What do I now do with my kids who are now running around while I'm trying to actually work?
Right.
The third thing that we started noticing is the number of spouses that then had job losses. So now you've got the stressor of having the kid at home, you've got the job loss, you're trying to figure out how do you do all this stuff together. And so it all starts to meld together. And what we're starting to see now as we're trying to come back into the office is the exact opposite of, I've learned to live my life this way over the past year. Now what do I do? And so now you're going through this second wave of destabilization of the kids are now going back to school. How do I now get them transported back and forth? My spouse may or may not still have a job, so what do I do there? And so you're seeing families that are just under a tremendous amount of stress of trying to, one, prepare a home to be able to manage through the situation. But now watching things change where you're having to come back in the office and having that really traumatizing them a second time.
Yeah, you bring up the point about families. Well, I want to talk about children because they were a portion of the population that I think was not recognized until later on in the pandemic. We're talking about school-age children that now, because of different things, they're back in the home. Let's not even talk about internet access. So many had lack of internet access or poor internet access, no direct contact with their teachers. So there was an education gap there. And then whatever dysfunction may or may not have been in their homes. So can you talk a little bit about that, Dr. Scott?
Yes, absolutely. So the population that I work with is actually college age students, so a little bit older, but I think the experiences have been similar. And what many students all the way from adolescence to young adulthood have experienced is increase in loneliness, feeling overwhelmed by the workload, and then adjusting to virtual learning. As a person who also teaches, I did not like virtual learning. And I told my students, like, you're not going to get the best version of Dr. Scott this semester. And I'm probably not going to get the best version of you. And what I found with that conversation is it helped normalize that we are in a pandemic, and you are not going to perform at 100%, and neither will I, because that's an unrealistic expectation. So part of it, with depending on the age, appropriate level of children, is helping them understand that what you're feeling is normal. It's okay that you're feeling confused or having a difficult time concentrating, because what often happens is they believe that something is wrong with them. That, I'm struggling. My friends don't seem to be having this problem, or why is it hard for me to remember? Just helping them understand anytime we have sudden changes to our routine like that, it throws us off. And we didn't have prep time for this pandemic. For many of us, break, and then they never came back. So really just helping them understand what is happening, and then allowing them to name it as grief. And again, these are age appropriate conversations, because many may be grieving the loss of that routine, the loss of graduation, the loss of homecoming dances, the loss of prom, and helping them manage those feelings associated with that loss.
Yeah, Dr. Scott, I'm so glad that you said that, and we're going to talk about some solutions and resources in a little bit, but I love the fact that you said to your students, listen, I'm having some challenges too, so let's work through this together, because I think that normalized it and made students feel like it's not just me, you know? And I think that's so important when we, talk about these conversations about mental health. And I have to say, particularly in Black and Brown communities where there's such a stigma in the first place about mental health, and we're not comfortable having those conversations. And I would even say we think of mental health as a bigger thing when it may be I'm just one more situation away from going over the edge. I think, and you guys can speak to it much more than I can, that we have to address it when it's small, when it's very early, so it doesn't end up getting big. Wouldn't you agree? I guess, Mr. Myers, do you want to jump in here? Can we get his mic unmuted, please? Can you unmute your mic?
Homeless population. Hello?
Yes, sir. We can hear you. Thank you.
Yes, with the homeless population, we've had the same challenges as everybody else. But the program that I work for, we deal with folks that are most vulnerable, which are homeless folks with a mental illness. And so prior to the pandemic, we provided support systems for them for housing, vocational, groups, and so we had a lot of contact with them. And with the pandemic, they experienced a lot of isolation, and they also were parents and they had jobs, and so they were in a position that they couldn't get any help. I also deal with the school system, and with the pandemic, with kids, with the schools shutting down and kids prior to the pandemic, we had some learning challenges in the African American community with student achievement. And so with the pandemic, with the schools closing down and not having internet access, you can see that double that problem, so to speak. And so everybody was just challenged by it. I think as moving forward, we have learned from the pandemic that a lot of folks that's on the margins of our society and our community, like the homeless and folks that's unemployed with no affordable housing, all of the things that have come to the forefront. And so I'm just encouraged that we see some of the crises that we have, and moving forward, we can address those. But the homeless population, I think, suffered severely because of lack of services.
Yeah.
Primary care physicians' offices closed, jobs closed down. So we had a great challenge. And so we increased our contact with that population to help them cope. And another issue that nobody talks about is the death and dying and the grieving process that every family had to experience. And the homeless population, even in the public school system, we had a lot of folks that were victims of the virus. And so death and grieving was something that we had some severe challenges with.
Yeah. The other thing was senior citizens who experience anxiousness, anxiety, uncertainty, and sometimes even loneliness, and not sure how to handle and alleviate those feelings. Does anybody want to jump in and talk about that?
One thing I will say is I'm glad you brought that up, because I think sometimes that's a population that gets ignored in many of these conversations. And what we've learned from previous pandemics, even back in SARS, which I think was maybe 03, 05 area, is that we saw a spike in suicide in that older population. And when you think about some of the predictors or the risk factors of suicide, things like loneliness, feeling hopeless, and depending on, the older population and not having access to people, that's going to exacerbate those things that are already in existence. So I'm glad that is a question, because I think they can get lost in this conversation. We often think about children and the, working from home, but what happens to the elderly population who already may not have access to as many quality resources? And then you have a pandemic and many of those things have been shut down. So that is an area of concern, is making sure that our elderly population has access. And then on the flip side, what we've noticed here at University of South Carolina, when we surveyed our faculty and staff, we did weekly surveys and we asked for qualitative feedback. We found that our older employees in the 55 and up range were coping better with the stresses of the pandemic than our younger population. When you think of life experience, many cited that. As a reason, is that it gave them opportunity to spend more time with their family, and they've been through bad things before, so they were to pull on that resilience to cope with this. So just wanted to point that out.
Yeah, you're watching the South Carolina Legislative Black Caucus and Prisma Health present the 2021 Minority Health Summit. I'm Trey Taylor. That was April Scott. You just heard she's Associate Director of Mental Health Initiatives at the University of South Carolina. To her right is Dr. Kenneth Rogers. He's a medical doctor, State Director of the South Carolina Department of Mental Health. Above him, you see Dr. Edward Thomas Lewis, President of the South Carolina Psychiatric Association. And to his left, Dr. Aditi Bustles, Director of Research at Children's Trust of South Carolina. And we did have Kenneth Myers down there. I think he left us. He's with the Assertive Community Treatment Act with Prisma Health. Senator Sapp, I want to ask about what's going on at the State House. I know the Senate just finished at least part of their initial part of the budget process. Tell us what's in it that's directed towards the overall theme of today's summit, health. And can you also explain the process moving forward with the budget, sir?
Sure. So let me just say how delighted I am to be a part of this panel discussion. And for those of you who are wondering why they have me listed as a co-moderator, it's because I didn't need to do anything. We've got three. All I have to do is come along for the ride, but I've got nothing but love and appreciation for what Trey is doing with her podcast. And
thank you.
We just wish her Godspeed and continued success. And so the budget process I thought was good. And quite honestly, the budget process has not been just what we've done this week. It's been since this pandemic began. And I think that we've responded in a significant way as it relates to making certain that all of the personal protection equipment is in place in order that our students who decide to go back to school can go back in a safe sort of a way. So we've continued to provide what we believe is necessary and respond to the requests of DHEC from time to time to meet the needs of our citizenry. I think it's important that people know who are experiencing problems as it relates to paying their rent and all of those kinds of things, is that the moratorium that was in place that would not allow persons to be evicted from their homes, there is help available. So to the extent that they did not have to pay the landlords as things went on, now they're worried about, I'm so much behind, how can I catch up? What am I going to do when the moratorium is lifted? And so we want people to know that there is rental assistance money out there that will be available to them. And so the idea and the stressors that are related with having to come up with all of that money in order to continue to stay where they are, there is help on the way as it relates to that. So there continues to be allocations in the budget to help out with all of those kinds and sorts of things. Don't want to go into the broadband and how it exposed the fact that broadband is really a need and not a luxury.
Yeah.
So I could go on and on as it relates to those things, but if you don't mind, I did have a couple of follow-up questions for our panelists, and I wanted to start with Dr. Scott. And one of the things that continues to concern many is we all know that there is some loss of learning as it relates to our children. The question is, how are we going to treat them as far as the ones who have not been focused, who have turned on their computer and then have gone away and played video games and all of those kinds of things? How will we grade those students? And I've been advocating this notion of grace over grades until we get beyond this point where we can try to do some catch-up learnings and stuff like that. Would you mind just kind of chiming in?
You kind of said my answer, which is grace. So, I mean, I'm not on the academic side as much as far as making no decisions, but in my work, I do work with faculty and staff, and I encourage them to exercise grace and to be lenient, even in the assignments, lenient with due dates, because there are so many other factors that students are dealing with. Someone mentioned loss of jobs. We've had students who had to take on jobs because parents lost their jobs, or who had to begin babysitting because their parents had to work extra shifts. So be lenient. And also recognize the same anxiety you're feeling, they're feeling tenfold, and they also don't necessarily have the developmental maturity to know how to respond to it in the same way, for lack of a better word. But I would say focusing on grace over grades, as you said, and really working with faculty and administrators and understanding the why. So I think the best thing is to advocate on behalf of students to the people who make those decisions and helping them understand how that will be more beneficial in the long run, instead of holding them to an unrealistic standard they weren't able to meet in the first place. So I would echo, I like the grace over grades. You said it much more articulately.
Well, thanks. And then the other component is a moving forward kind of component. And so we know that there's been a lot of money coming down from the federal government that's supposed to assist us in catching up. And so one of the questions is, how are we going to figure out how to get parents into the fray and make them a part of this catching up process? Has anybody given any thought to that?
At the Children's Trust, we actually have parent advisory councils that we actually have parents come in, and we remove all of the barriers to them being able to participate in these decisions. So we provide transportation, we provide stipends for their time, right? We make sure that we meet at a place where we're meeting our families where they are at to get that authentic voice. Senator Saab, I think you're absolutely right in that we can't make decisions about education, particularly for young children, without parents being a part of that conversation. Right. There's a lot that's missed sometimes in our our hopes and intent to build good policy. And so, using those structures of really leveraging existing community networks, leaning on those community champions that have developed trust with parents in their community to bring them out and together. And most importantly, seeing them as equal in some of the decision-making processes. So giving them that same time and respect that we would give, a medical expert about COVID when they're sharing their perspectives on how we should spend this money is really what builds that empowerment for us to see some of those positive long-term health outcomes. And if I just may add to Dr. Scott's point about grades and grace, maybe that was also you, Senator, is I think it's also important for all of us that work with children and families to shift our thinking about good and bad behavior. One of the things that we talk about in our work is that there's no such thing as maladaptive. Every child is simply adapting the best way they know how, despite their circumstances. And when we remove that label of maladapting, or this is, socially unacceptable behavior, and we start to see how events like the pandemic or the increased rates of domestic violence at home because of this pandemic, or mental illness being exacerbated by this pandemic has detrimental impacts on early childhood development, we start to then move forward with solutions that are not so focused on blaming the child or the parent, and more so a holistic community-based approach that can ensure that they come out of this pandemic strong.
Yeah. Senator Sapp, did you have another question or comment?
I wanted to do two more follow-ups. I wanted
yes, sir.
With Dr. Bustles one second, because a lot of what you talk about, I believe therapists can assist in. One of the problems we have, though, is the stigma that's associated with contacting a therapist. I mean, I don't think society has gotten to a place where we understand that therapy is just a part of our wellness, and so it does not. There's no shame in the game of talking with the therapist. So I'm curious about your thoughts as it relates to us and removing the stigma in order that people can take advantages of the services that are available.
One of the ways that we've been able to remove stigma has been using this concept of adverse childhood experiences, or ACEs. And when I always go back to the data to help normalize, right? 60% of South Carolina's population reports one or more adverse childhood experiences in their lifetime. And this is not different by racial, ethnic group, gender, sexual orientation. It's pretty prevalent across populations. And so when people hear that and they see what different experiences qualify as childhood adversity, they realize, I know someone that's experienced that, or I may have someone in my family that's experienced that. And when you're able to present them something that's easily relatable, you start to see some of those barriers and stigmas be removed, that this is just those people problem or that community problem, right? So I think language and providing data to back what we're talking about is very, very important. And then in terms of kind of the need for therapy and some of those specialized services, I think another way that we can continue to normalize mental health is by providing universal prevention. And one of the ways that I know that my colleague, Dr. Rogers, would probably agree is by ensuring we have mental health clinicians in every school or every setting that a child interacts with, right? Because everyone benefits that way. And there are strategies that they can take, like standing in the school pickup line. And yeah, they're not a teacher, but they are that mental health therapist or clinician that's there, that's part of the community, that is getting to know the whole population and is able to employ universal things to remove some of those barriers for kids to then take advantage of some of those more specialized services that they may need. So I think the overarching kind of question is, how do we remove barriers and provide these supports and services in non-stigmatized places? And how do we talk about it in a way that it's not therapy, it's simply taking care of your health or self-care.
Yeah, you're watching the 2021 Prisma Health and South Carolina Legislative Black Caucus 2021 Minority Health Summit. I'm Trey Taylor. Senator Ronnie Sapp is our co-moderator. We're also joined by Dr. Kenneth Rogers, State Director of the South Carolina Department of Mental Health. Also, Dr. Aditi Bustles, who is Director of Research at Children's Trust. Dr. April Scott is Associate Director of Mental Health Initiatives at the University of South Carolina. Dr. Edward Thomas Lewis is President of the South Carolina Psychiatric Association. And hopefully we'll be rejoined by Kenneth Myers, who is Assertive Community Treatment Acts at Prisma Health. Senator Sapp, before you jump back in, I want to bring Dr. Rogers and Lewis back into the conversation as we talk about breaking down the stigma and making Black and brown folks more comfortable about even reaching out to folks for mental health issues, and what resources are available from these entities. Dr. Rogers, can you jump in first, please?
Thinking about Senator Sabb's comment, about how do we think about stigma. And one of the things that we've done at the Department of Mental Health and very focused on right now is our community faith partnerships. We know that church is a big part of many of folks in our community's lives. And so one of the things that we're doing is, rather than thinking about mental illness and thinking about mental health, really thinking about the idea of wellness. And how do we really begin to think about wellness in the context of your physical health, your spiritual health, what's going on in the community, et cetera. And so part of what we're looking at is working with churches to actually create the capacity to be able to support members in their own congregations. Because if you look at the stressors that are out there, many people don't need what I would think of as your traditional therapist. They don't need to come sit in the office with someone for 55 minutes and talk through things. What they really need is somebody who's able to say, here's a stressor, I'm going to come alongside you, I'm going to help you through this time period and get you where you need to be. And if you need something more than that, we have the capacity and we know these folks that we can now refer you to. And so we're really trying to break down things from the mild to the moderate to the severe, so that people will be able to get what they need at any given point in time. Because 60 to 70% of people that are out there now, even that are experiencing the stressors that we're going through, really don't need to actually go in to see a therapist. But then having those services available that can be easily accessed by folks in the community.
Yeah. Dr. Lewis, do you want to jump in the conversation, please? I saw you shaking your head in agreement with Dr. Rogers.
Yes, thank you, Trey. I mean, I think so many good points have been made here already. The only other thing I thought to add into the conversation is a lot of times people will ask me, I see someone struggling, or my friend, my loved one isn't themselves, and I'm hesitant to talk to them about it, or how do I bring that up? I don't want to make things worse. And I know Dr. Scott can certainly speak to this from the suicide prevention literature, but we know asking folks about their mental health and how they're doing, or even if they're suicidal, is an okay thing to do if they're struggling or bringing up issues or concerns. And so I think of this as starting with a conversation. So in other words, I may have someone in my network or circle that is struggling with some mental health issue or struggling with this pandemic and everything going along with it. And they may be scared for a variety of reasons, or daunted by the mental health system and getting a therapist or a psychiatrist and what all that might mean for them. But if it's approached by a friend or a loved one or someone that they respect in their network, and it's a conversation, then I think it has the ability to launch them into getting the care and the help that they need. And I just want to echo with what Dr. Rogers said, that a lot of people right now who are struggling aren't going to need long-term specialized care. What they need is problem and solutions-oriented treatments that are available and evidence-based. But the challenge, of course, and we know this already, is that in our minority populations, getting evidence-based care is a challenge. When we look at the kind of mental health services that someone who is Caucasian might receive, is going to look different oftentimes than what our friends in the Black community will receive. And so that's an issue underlying all of this in the conversation that we need to bring up.
Yeah. All right. Well, let's bring it up. Let's bring it up and let's talk about, the fact that there are disparities. Herein lies another disparity as it relates to healthcare, mental health care. Black and brown folk are not getting what they should be getting, what they deserve to get. So how do we address that?
One thing I would like to add, I'm sorry, Dr. Lewis, were you about to?
No, Dr. Scott, jump in.
Having practitioners that reflect the population that you're trying to reach, because that is a big barrier, even as a therapist also. That's a question I often get from students is, how many Black counselors are there? And having to tell them not very many, that often is a barrier. And then even going further into that pipeline of how much of the process to become a licensed counselor, a licensed social worker, how much of it is cost prohibitive? How are we recruiting people into the field? And also acknowledging the historic racism that has existed in the field of medicine, in the field of healthcare. Because I think sometimes we want to rush to the idea of unity and let's just all get together without acknowledging the hurt and the harm that has been present in the field. So I think if we can acknowledge what has happened, try to atone for it, have people who look like the population that we're trying to reach, whether through outreach. I love Dr. Rogers' suggestion of using faith-based communities, have community supports, NAMI, Mental Health America. There are so many other organizations that use peers to deliver the message as well. For those lower level interventions, I think are great starting points.
Yeah, I love that too, Dr. Scott, what you said, Dr. Rogers, because you can love Jesus and have a therapist too. It's okay. They're okay. They're okay with each other. We're talking to health professionals about mental health and how COVID has affected it. It's one of those silent symptoms that a lot of people dealt with, whether small or large. I want to talk about now some of the resources that are available for folks who are having challenges, and then talk about how do you approach someone in your family, your friend, that you may think is a little bit off, or for lack of a better word, or just having some challenges dealing with the pandemic. And really, it is a twin-demic. It's race and racism, and it is the health pandemic. Thank you, Mr. Myers, for being able to join us again. So can we talk about that? Let's talk about resources. Let's just go through the panel and talk about resources. Mr. Myers, since you're in here, let's get you in and talk about some of the resources that are available through the ACT team at Prisma Health.
Well, through the ACT team, we call ourselves a wraparound services. When we engage consumers, we have a benefits person. We get their Social Security, we get their Medicaid card, we get them a primary care physician, we get them housing. We make contact with their families. Even if they get incarcerated, we follow them to the local jails. And so we are also partnership with Transition and other homeless programs around the city. We're fortunate in Columbia because we have a lot of services for the homeless population and that type of thing. So, but we try to provide just wraparound services, which has been challenging because of the pandemic, but we do increase our personal contact. We see our consumers at least 4 to 5 times per week. They see a psychiatrist as needed and at least every 2 weeks. And so we try very hard to engage them and be hands-on so they can get the resources that they need. Vulnerable populations have difficulty having access to health care. And that's why with the stigma and that type of thing, we also partner with churches and other shelters that do is feeding. So there's a lot of places in the capital city that soup kitchens and that type of thing. So we try to make sure that we provide resources. And we also have 2 licensed social workers that do case management as well. So we would like to think that we really try to take care of all of the needs of the consumers. And also with the challenge of masks and hand sanitizer and the continuing education that the virus has not gone away, that we need to be mindful of wearing the mask and social distancing. And we have an initiative to get everybody vaccinated. And we do a lot of teaching and we talk to a lot of churches and we go on a lot of radio shows to put information out in the community. And for the Black community in particular, you have to deal with institutions that they trust. And that's family members, that's barbershops, hair salons, and faith-based churches and that type of thing. So the main thing is to keep talking about it and for them to hear people that they trust and know, give them that message. So we have a lot of misinformation that's been around. So we are trying to neutralize that.
Yeah, thank you, Mr. Myers. In the last couple of minutes,
Yeah.
and Senator Sabb, we're going to end with you to finish out talking about the budget and any other comments you have. But I do want to go through each panelist and talk one about what resources are available and how that information is being disseminated to the community. Dr. Rogers, if we can start with you, please, and then we'll go around.
Sure. I'm actually proud to be the state director for the Department of Mental Health. For those of you who don't know, South Carolina actually has one of the few state-funded mental health systems in the country. We have 16 mental health centers with 63 sites of locations throughout the state. We're in all 46 counties in South Carolina. We're also in 65% of the schools in South Carolina. The nice thing about the Department of Mental Health is everything is on a sliding scale if you don't have insurance. And so there's always a local one in your community. And so if there is a need, please feel free to show up.
If you can put that information in the private chat, we'll make sure the folks get it into the stream. Dr. Scott?
Yeah, so again, my real current is the University of South Carolina, but I will say for resources within the state, South Carolina recently launched an interactive screening protocol, ISP, where people can log online and complete a somewhat of a depression questionnaire. And based off the results, they can receive feedback from a counselor to give them recommendations on next steps. And I'll pull that link and put it in the chat for you all as well.
Awesome.
To the last question you said, the best thing you can do, and echoing Dr. Lewis stated, is to ask. If you are worried about someone, because stigma survives in silence, and what we don't speak about, we can't heal. And when you ask specific questions, be very specific about what you notice. So not, hey, you've been weird, but no, this is actually what I'm noticing and I'm concerned about you. Is there anything that I can do? So those are the things I would definitely will offer, is to be very vocal, very clear, and very specific, and always end with an offer of assistance to help them get the proper resources.
Awesome. Thank you so much. And Dr. Bustles?
At the Children's Trust of South Carolina, we work with child and family serving professionals that provide wraparound supports for parents and their kids. So we have several programs, including the Positive Parenting Program, and this is in specific counties. You can check out our website, scchildren.org. We have a families program, and we have home visiting all across the state as well. It's been really amazing to see how we've been able to pivot during the pandemic and provide these services virtually to parents and kids. And alongside that, for all of you that are watching that are interested in the data and the research behind mental health in kids, we have all of that available in the form of briefs, profiles, and reports on our website as well. And to echo what you can do, we can't ignore that on top of experiencing this deadly virus, we also experienced a racial reckoning in this country, with whether it was the acts of police brutality or recently the hate attacks against Asian Americans. And what I would say there is continue to take care of yourself. And when you can take care of yourself and have the space to ask others, ask them and normalize and continue to talk about it, because this is not a normal time. And it's not going to help us to continue to pretend that we're just going to go back to normal, because we will be forever changed and we have a lot of work to do, but we're on the right track, I think.
Absolutely. And Dr. Lewis?
Yes. So I want to mention 3 brief resources. First, I'm here today as the president of the South Carolina Psychiatric Association. So we are a membership group of over 400 physicians who specialize in mental health here in the state of South Carolina. And our organization, I'll include the link to the website in the chat, sccpsych.org. We are happy to connect folks with providers and physicians in the area if they need that resource. So that's a great resource. The other 2 I want to mention are free and available to anyone. NAMI, or the National Alliance on Mental Illness, is a fabulous resource for both individuals who may be struggling with mental health concerns, but also for family members. There's just really great materials available. What I like about NAMI is we have chapters all across the state of South Carolina. And so in your community, you can go on the web and actually locate the nearest NAMI resource chapter, and there's a point person. So there's actually a live person you can connect with and get some more help and resources. And there are also virtual community support groups going on through NAMI, which are great. And then the last resource I want to mention is the American Foundation for Suicide Prevention, which is also a nonprofit that does a lot of fabulous research and work on suicide prevention. And they have a hotline that's available 24/7 for anyone who's struggling with suicidal thoughts. And so really the combination of those three resources, I hope to just kind of add to the conversation and that it may be of help to someone.
All right. Thank you so much, Dr. Edward Thomas Lewis. And last but certainly not least, Senator Ronnie Sabb, can you continue to finish telling us about how those funds will be disseminated through the budget and any other comments that you had, sir?
Sure. So let me start with the comments first. And I just wanted to, again, express my appreciation to all of you for all that you do, especially Mr. Myers, who works on the school board. And that's a thankless job if there is one in America. And so I just have such an appreciation. The other thing I can say is that time flies when you're having fun.
It does.
Almost at the end of this, but I wanted to challenge Dr. Lewis and Dr. Rogers because we have a problem with not enough facilities to treat the mentally ill. And I wanted to get into that discussion today, and obviously time is not going to permit, but I want you all to please, sirs, give that some thought and please contact me with some thoughts because it's a problem that we've simply got to solve, in my humble opinion. So real quick, just a couple of more things. So where we are in the budgeting process is that all the budgetary legislation begins in the House of Representatives. And so they then send the budget to us. At some point, we then deal with the budget, which we have done. The budget now has to go back to the House to see whether or not the House concurs with what we put in. Typically, they will not. And so a conference committee is therefore formed, 3 members of the House, 3 members of the Senate. They get together and they hash out the differences. The beauty we have this year, though, is many of us have been talking about budget 1, budget 2, and budget 3. Because of all the federal dollars that's going to be coming down our way, we're challenged with the idea of figuring out how best to utilize those funds. But I did want to highlight a couple of things that I think are significant in the budget. One is we're still continually focused on teachers and teacher pay. And so we've inserted $1,000 for every teacher. In addition to that, we'll have the step increases also. Higher education, the deferred maintenance, we have put, I'll just call it a bunch of money in there for our colleges and universities in order that they might deal with some of the maintenance needs that they have. The other 2 things that are dear to my heart is there's an effort to create a memorial that's representative of the loss that we experienced with the Emmanuel 9. And so I'm pleased to say that we have put money in the budget that will lend itself hopefully to getting them closer. And that memorial is going to be beside the church and not too far from the African American Museum. And so it's something I think to be excited about. Last but not least, we got a problem with schools in rural South Carolina and the fact that the local communities don't have the money to build schools. And so we've still got Burns schools that are out there, schools that were built in 1954. And those communities will not have the resources to do it. It is the state's responsibility, in my opinion, to help out in that regard. And so we've begun to address the need by putting $100 million in the budget for that specifically. That is not enough, but it's a start. And so had a good budget session by and large.
Great. It's been my pleasure and honor to have as co-moderator for this session, Senator Ronnie Sabb. Drs. Rogers and Lewis, you have your marching orders from Senator Sabb. So let's connect and get this thing done. Today's session has been awesome. Health 2021 Minority Health Summit from Prisma Health and the South Carolina Legislative Black Caucus. Want to thank all of our panelists, Dr. Aditi Bustles with Children's Trust of South Carolina, also Dr. Edward Thomas Lewis, President of the South Carolina Psychiatric Association, also Dr. Kenneth Rogers, State Director of the South Carolina Department of Mental Health, Dr. April Scott, Associate Director of Mental Health Initiatives at the University of South Carolina, and Kenneth Myers, Sr., Assertive Community Treatment Act with Prisma Health. Thank you all so much for joining us. Thank you for the links. Be sure to put those links in the chat. We will disseminate them via YouTube and Facebook. And if you are watching, please continue to check out those resources. spread them and share them with those folks that need it. And also, please continue to post and share this important information out. Coming up next, what Black men need to know about their health. That's next on the 2021 Minority Health Summit from the South Carolina Legislative Black Caucus and Prisma Health. Thanks for joining us. Thank you all so much.
Thanks, everybody. Thanks, Trey. Fantastic.
Thank you.
Hi, my name is Jason Carey, and I am a medical science liaison with GRAIL, a company whose mission is to detect cancer early when it can be cured. We are honored to be here today and to partner with the South Carolina Legislative Black Caucus to further our mutual effort to address health disparities. As a young company, we're excited to be a part of this exceptional community, and we're honored to be here today. In South Carolina alone, more than 10,000 residents will die of cancer in 2021. Compared to national averages, South Carolina faces a higher incidence rate of breast, lung, kidney, and other deadly cancers. The earlier that cancer is found, the higher the chance of successful treatment and survival. Yet, too often cancer goes undetected until it has progressed to an advanced stage. Using the most rigorous science, we are developing a blood-based early detection test to change the trajectory of cancer mortality. Communities of color are subject to pervasive health disparities, including cancer screenings, treatment, and incidence. Take, for example, stomach cancer. Stomach cancer does not have an available early screening test and disproportionately affects Black Americans. It is the 6th most common cause of cancer death in African American men. This is one example among many others that illustrate the burden of late-stage cancer on communities of color. By developing effective early detection technology that can easily be implemented and widely accessible by patients in all communities, we can help reduce cancer disparities. Multi-cancer early detection has demonstrated the ability to detect dozens of cancers that lack available screenings and can be done through a simple blood draw. By identifying more cancers earlier before they spread, multi-cancer early detection could be the innovative breakthrough that turns the tide in the war on cancer. Multi-cancer early detection could help close health disparity gaps through the relatively easy testing process. Once available, a primary care clinician could easily administer the test as a part of a usual checkup. That would make cancer screenings more accessible for all of us. Like those of you who are involved with the caucus, we're inspired by the community to make strides against the burden of cancer in South Carolina and across the country. We are proud to support the South Carolina Legislative Black Caucus and be a part of this community. Thank you for all of the work that you do.
There's nothing quite like a day at the beach, dinner at grandma's house, or a good game. Thankfully, the COVID-19 vaccine will help us get back to doing the things we love most. And while that's great news, it's natural to have some concerns. The COVID-19 vaccine is safe. The vaccine will not give you COVID-19. Even if you already had COVID-19, you still need the vaccine.
I know there's a lot of anxiety associated with this, but I'm confident in the FDA in making sure they have approved an effective vaccine.
Don't be afraid. It's here for our good.
The vaccine is safe, the vaccine is effective, and it gives us a means to prevent that higher risk of disease, higher risk of hospitalizations, and higher risk of death.
Join us in building community immunity. Get all the facts at prismahealth.org/19facts.
Thanks for joining us for the 2021 Minority Health Summit from the South Carolina Legislative Black Caucus and Prisma Health. This brings together SLCBC members, health organizations, professionals, and leaders from across the state to provide information and conversations focused on health issues impacting South Carolina's Black and minority communities. Our third panel, what Black men need to know about their health. Our panelists for this session include Vince Ford, who serves as the Senior Vice President of Community Affairs with Prisma Health. Previously, Mr. Ford served as a Richland School Board member, worked with the South Carolina Commission on Alcohol and Drug Abuse, was also a Benedict College trustee, and served on the University of South Carolina African American Community Advisory Board. Dr. Jandra McNeely is a graduate of the University of North Alabama in professional biology and received her doctorate of optometry from the University of Alabama. Continuing her education, she completed her externship at the Tuscaloosa VA Hospital, focusing on eye disease and primary care, and has been in practice in the upstate since 2009. Currently, Dr. McNeely serves on the South Carolina Optometric Physicians Associate Board of Directors. Christopher Likes is a former DHHS employee working as a program manager for physician services and PT, OT, and speech. Mr. Likes started a consulting business focused on bringing together lawmakers and healthcare organizations like Alzheimer's and cancer, and has also helped create a partnership with the Alzheimer's Association and the International AME Church. Reverend Dr. Jacques Days is the South Carolina AME Health Commissioner. Dr. Days has also worked in private practice and community, corporate health, and correctional health, and served as the consultant for the Department of Mental Health at Bryan Psychiatric Hospital. Co-moderators for this session include Representative Terry Alexander, elected to the South Carolina House of Representatives in 2006, representing District 59, covering Darlington and Florence counties. Currently, Representative Alexander serves on the Regulations and Admin Procedures Committee, as well as the second Vice President of the Education and Public Works Committee in the House of Representatives. And Representative Marvin Pendarvis was elected to the South Carolina House of Representatives in 2017, representing District 113, covering Charleston and Dorchester counties. He serves on the Legislative Oversight and Agriculture, Natural Resources, and Environmental Affairs Committees in the South Carolina House of Representatives. Representative Pendarvis is also a practicing attorney at the Pepper Law Firm in Charleston, South Carolina. Please welcome our panelists for What Black Men Need to Know About Their Health.
Thank you again so much for joining us for the Prisma Health and South Carolina Legislative Black Caucus present the 2021 Minority Health Summit. This is panel 3, and what Black men need to know about their health. Well, we'll start with a couple of Black men first. Chris, can you tell us what Black men need to know as a Black man about your health?
Well, one thing I would start with is Black men need to check their insurance. It's so important to know, as I was speaking with my dad last evening, to know specifically what's covered on his insurance. I'm like, Dad, you need to know, this is covered. Your eye stuff is covered. You might have dental health services covered. Before you go to your doctor, know what's covered so you won't be expected to get this strange bill in the mail that says this is not covered. You owe this amount or that amount. This has happened, a lot of times with my family, with a lot of my family members. So one of the things I try to let folks know is to study that book that they give you. I know it's big, but sometimes you need to read that book and know what's covered and what's not covered when it comes to your insurance.
Yeah, thank you, Chris. That's so interesting because I think when we talk about what Black men need to know, I think that's probably one of the things we hear the least, which is check your insurance and make sure you know this, this, and this. I think we'll probably hear more about other things, check your blood pressure, your prostate, things of that sort. Jandra, I'm going to skip you just for a minute and go to Dr. Days. Dr. Days, what do Black men need to know about their health?
Good morning. What Black men need to know about their health is that they have some power in controlling what happens with their health, and there is power in connectedness with others in the African American community and the broader community in empowering persons to take control of their health. For example, the CDC National Vital Statistics suggests that the leading causes of death nationwide and in South Carolina are heart disease, cancer, and accidents in that order. However, for African American men specifically, it's heart disease, cancer, and cerebral vascular disease, followed closely by accidents. All of those things can at the very least be mitigated to some extent, and they can, in some instances, be prevented. Mitigated, for example, with heart disease by controlling blood pressure, avoiding cigarette smoking, exercising regularly, losing weight, prevented, for example, in some instances, like, for example, colon cancer. Screening for colon cancer properly can catch the polyps before they change over to cancer, and those polyps can be removed, and thereby you have prevented cancer. And so African American men, as do all persons, have some control over the course of their health, and can take that control by practicing some lifestyle changes that prevent and or early treat illnesses and issues.
Yeah, thank you, Dr. Days. Vince, as a Black man and as a healthcare professional, what do Black men need to know or do about their health? Vince, you're muted.
Thank you, Trey, and to the South Carolina Legislative Black Caucus, and to all of my colleagues on this panel, and my good friend, Representative Terry Alexander. I had a chance recently to spend a 12-hour shift in the emergency room. And I remember being in there for those 12 hours, and something happened that I'd heard about, but I'd never actually witnessed. And that was, they called the code. It's called Code Blue. And what that means is that everybody has to stop what they're doing and go focus on that patient. As I thought about this presentation today, I thought, as you talk about African-American men, that's exactly what needs to happen with African-American men. We need to call code. Because when you look at life expectancy, we have the lowest life expectancy of any demographic, and people ought to be concerned and alarmed about that. I mean, we die at a rate of between 7 and 10 years earlier than anyone else. And when you start to look at health outcomes, our health outcomes are very, very poor. And so we should be concerned about all of the issues related to health and wellness. Now, whose fault is it? Whose responsibility? Let me start with putting the responsibility back on African-American men, that we're responsible. We have to take responsibility for our health and well-being, that we have to start doing things. As Dr. Day says, we need to start going to the doctor. We need to have a primary care doctor. Many African-American men don't. They don't have a primary care doctor, nor do they go see a physician. They wait and wait, and then they'll end up in the emergency room. They need to start getting things checked out earlier in the health and well-being process. But I also want to send a message to African-American women, especially African-American women, because you are critical in the health and well-being of African-American men's health and well-being, because one, they're going to listen to you. Two, you have a selfish interest to make sure that they are healthy and well. And then I'll end with a quick story. I was asked by my staff, Brother Likes, about prostate cancer some years ago. And they said, what would convince African-American men to go in and get a prostate exam? And so I shared with them, here's some things that won't make me go. A billboard, a newspaper article, even a TV show. But what would make me go in and get an exam would be my daughter. If my daughter said, hey, Dad, I want you around for my graduation or for my marriage, or Pastor Days, the First Lady of the church is also critical in this process. We've used the First Lady in the church to share information with congregants, particularly African-American men, and they tend to listen to the First Lady of the church as they listen to the pastor as well. So all the issues and concerns we ought to be beeping because there are concerns up and down the list when it comes to our health and well-being.
Yeah, well, game, set, match, Vince, you've talked about a lot of the things that, we were going to cover a little bit later. And I definitely want to, when we talk about how women can affect men, I want to know the secret sauce, because I think, women have been trying to tell men to go to the doctor, for a long time. So I'm definitely going to pose that question to you so that we can figure out what we need to say specifically. So glad to have as co-moderators, Representative Marvin Pendarvis and Representative Terry Alexander. So I want to go to you, Attorney Pendarvis. What do Black men need to know and do? And you're probably one of the youngest ones between you and Chris on the panel. So is it different?
Yeah, well, good morning, Trey, and thank you for allowing me to be part of this. It's always good to see my good brother, Representative Alexander. I will tell you, I appreciate Brother Ford and his comments about how Black men have been extremely reluctant to even get a primary care physician. And I tell you that because that's something that I've had personal conversations with members of my own family. You're right, I am probably one of the younger members of the call, 31 years old. And I know, when we talk about health and making sure that we're around for milestones, not only in our lives, but our family and the close ones around us, we have to start looking at what we're doing each and every day in order to sustain our health long term. I'll tell you this. One of the things that I go back to when it comes to health is what are we doing, not only as Black men, and obviously that's the specific purpose of this forum, but as a people to develop and sustain healthy eating habits. I cannot emphasize enough how important it is, how much our diet impacts the longevity by which we're able to live life and how we're ultimately able to function as human beings. And so much of what I've done as a legislator has been geared toward that because it's important. If we look at so many African-American communities across the country, they're located in food deserts, a place where you cannot get the kind of nutrition that's going to lead to a healthy lifestyle. And so we see some of these disparate health outcomes in our communities that lead to some of the chronic illnesses that we have. There's a reason why African Americans as a whole were being disproportionately impacted by the COVID-19 pandemic. And it's because we had some pre-existing conditions that studies have shown us as were a result of our eating habits. And so, to bring the point home when it comes to what we can do as Black men to monitor our health, one of the things that I've had personal conversations with my own family and my own personal circle is to develop and create healthy eating habits. What are we doing to maintain a healthy diet? What are we doing to make sure that what we intake in our bodies is going to allow us to live the kind of life, as Dr. Ford said, that we were able to see the milestone in our daughter or our son's life, that we're able to be around to see different things and to be there. Those are the conversations that we have to have. I was having a conversation with, and I'll end on this note, I was having a conversation with one of my fraternity brothers not long ago, and we were texting, just catching up and seeing how we were doing, how he was doing, and he was checking on me. And, we were talking about our health. Right. It's been over 10 years since we both graduated from the University of South Carolina. But in our conversation, we were just talking about how we both want to be there for our children. I have a young son. He has young sons. And we were talking about having the ability to make sure that we're around for when they get our age. We're able to really be there for the critical parts of their lives. And so, we have to look at what it is that, it's beyond just us. So I want to make sure that the people on this call understand that we have a special obligation to do everything that we can to be around for ourselves, our families. And I think a lot of that starts by what we do, what we intake in our body.
Right. Thank you, Representative Pendarvis. Terry, you were one of the people with the South Carolina Legislative Black Caucus that really wanted to have this Minority Health Summit. So I know this conversation is important to you. So what do you think Black men need to know and do about their health?
Thank you, Trey. Thank you, Trey. Let me thank Vince personally and for his continued support of this conference. This is not our first one. I think about our fourth one. And Vince, you and Prisma has been there. I want to thank you so very much for that continued support. And to my brother and colleague, Pendarvis, good to see you. I think the main thing that we need to consider is the fact, particularly African-American brothers, is that we do get sick. I think, Vince, I think some of us think that we don't ever get sick. That, there is no need for medical care. There's no need for a doctor because this machoism that has existed in us over the course of a lifetime. We get sick, stuff happens, and Black men die. I don't think that we've grabbed that our health and our body is important to us. So we refuse to engage in insurance policies. We refuse to get a primary care physician, because we don't think that we get sick. And when we do have some sense of ailment, we refuse to go because we think it's something that is going to pass by. And that is a mindset that we somehow have to overcome throughout our communities, informing the brothers that, listen, you're going to get sick. Inflammation is going to come in your body and it's going to destroy components of your body. And you need to go to the doctor. And, we got these community health centers all over the state now, where it really is an easier lift now than it was before they came along, because now you can go there and get checked, get a primary care and you pay based on what you know, or you can just go to the hospital, go to a Prisma or whatever. But I think we need to know that we do get sick.
Wow. Yeah.
We don't think we get sick, Pastor. Yeah. We think we're going to live forever.
Yeah.
And I think that's crucial to us. And so we need to start educating and sharing information about men's health. As a matter of fact, Trey and Vince, last year's conference was going to be, the whole focus was going to be centered around, and we had it set up, was going to be centered around Black men's health. The whole seminar with individuals coming in, talking about Black health, the issues, the concerns, the questions, you know what I mean? And so we can discuss that and have a real conversation. I think, Trey, we did one some months ago about health in the Black community, specifically African American. So we need to continue this conversations in our churches, in our communities, with our fraternities, or wherever the case might be, because we do get sick.
Wow. Terry, that's such a great point. I think we all feel like we're invincible. We're going to be here forever, as heads of households, whether it's Black men or Black women. We feel like, we're focusing on everybody else except us. Dr. McNeely, as a member of the South Carolina Optometric Physicians Association, are there specific optical eye issues that Black men need to know about?
Absolutely. And thanks so much for having me. And you gentlemen on the call, I see most all of you doing so much good work. So thank you for that. One of the things that we're looking at every day is diabetes, especially. And I know this has been said 100 times, but, Black men are going to be twice as more likely to die from diabetes than, a white man. And so I think early detection is so key in that, because so much of the damage from diabetes is done early on to the body when you may not even know that you have it if you're not at the doctor. And so that, I think, affects your outcome later on. There's over 270 different systemic diseases that can be detected from an eye exam in one way or another. And so hypertension, high cholesterol, something that I wanted to bring up is sickle cell. Our sickle cell patients definitely need to be getting in for their eye exam yearly, because there's retinal disease that can appear from that. Glaucoma is a higher risk factor for Black patients, Hispanic patients. And so we're monitoring that. And I think that, I'm sharing just what Dr. Day said with these patients every year about diet, about exercise, about not smoking. And I think there's not a lot of good education. Sometimes I think the patients have a poor understanding of what diabetes really is and how to really, what they need to do themselves. And so, people will come for an eye exam because they can't see, they need glasses. And that's why we're checking blood pressure during our exams. And we're catching things that people who, are afraid to go to their primary doctor, but we'll pick up on some of those things and get them sent out for treatment.
Awesome. The South Carolina Legislative Black Caucus and Prisma Health present the 2021 Minority Health Summit. Please continue to post and share this important conversation to your social media outlets so that we can share this important information and figure out how we can help our Black and brown men concentrate more on their health so that they can be around longer for all of us. So guys, we know, and ladies, that we know that there are so many challenges, including men asking for help, men not wanting to go to the doctor. You guys talked about that. Why are there these barriers? And are there other obstacles that prevent Black men from going to the doctor? I know, Terry, you mentioned, men think they're going to live forever. It's the mortality issue. So what are some of the other challenges and why?
So
Dr. Day?
There've been a lot of historical reasons as why African Americans don't go. A lot of medical mistrust. I mean, Tuskegee is still in the minds of many African American men in particular. We've had challenges with our employment, the ability to get off from work. Brother Likes talked about insurance. That's an important issue. And then sometimes there's fear, fear of what's going to happen. And the man has had to be he's the man in the home, and so he has to show strength. Going to what Representative Alexander shared, and so he had to show that even when there was pain and discomfort, he couldn't stop what he was doing in terms of work and taking care of his family. But there's a new term that I want to lift up in this discussion, and I heard it on 60 Minutes a couple of weeks ago. It's called weathering, and it deals with racism. And how racism impacts the health and well-being of African Americans, and particularly African American men. And the gentleman, Dr. Williams, gave a great example. He said, if you take a drop of water and it falls on concrete every day, he says, if it just falls today, the concrete is probably going to be fine. He says, but if that drop of water just continuously drops all day, every day, sooner or later, that concrete is going to break. And that's what's happened to African American men. We have dealt with, and we continue to deal with, issues of racism and stress and other issues throughout our lives, even starting as young as Brother Pendarvis and all the way up to brothers my age. We've had to deal with that all of our lives. And Howard University did a study not too long ago, and they found that the average African American deals with 6 bouts of racism daily.
Wow.
Think about that weathering that just happens and then we have to manifest that stuff. We have to try to work. We have to try to perform, and then we have to try to go home and take care of our families. And the last thing that happens is, okay, I feel a little pain. Now I need to go to the doctor to deal with a system that hasn't taken care of me historically. And you want me to go spend my money, copay and whatever. You want me to go spend my money in those systems. And so so there are a lot of issues and concerns historically, but we've got to get beyond that. And I want to put the responsibility today back on African American men. I want you to take responsibility for your health and well-being. I want you to do the things that need to be done. 1, get a primary care doctor. 2, start to do things that are meaningful in life. 3, make sure you have someone who's meaningful in your life. 4, make sure that you have movement, that you move periodically, even if you don't get a chance to exercise every day. And of course, we need to eat in moderation. And then I want to pitch up one last thing, and that is to make sure that you get adequate sleep. Sleep is a critical factor. And there's a great book called Sleep Smarter by Sean Stevenson. I would encourage people to read that book. But we have to take responsibility. We have to hold those systems accountable. but we also have to take responsibility for our health as well.
Wow. Thanks, Vince. So, Dr. Days, in light of what Vince said, and I love the fact that he said, okay, all of that, but we still need to take responsibility. How do you, as a Black man, navigate through all of those years of oppression, depression, and then lift yourself up and move forward?
Thank you for that. And I said earlier that that we have some personal choices, some personal responsibilities, but also we have the benefit of connectedness. Mr. Ford and Representative Pendarvis said earlier that there's some personal choice issues, and I agree with that. But Representative Alexander said something that's very important, and that is that many of the health issues that we confront are caused by some inflammatory changes, pro-inflammatory things in our lives increases the risk for cardiovascular disease. Pro-inflammatory changes in our bodies increases the risk for certain cancers and certain of other health diseases. Mr. Ford said rightly that race plays an issue with that, because the stress and strain of, quote, being a Black man in America sometimes can cause some pro-inflammatory changes in our bodies that aggravate all of those issues that I mentioned. So health disparities are real, and access to care issues are real. I've heard Mr. Ford talking in the past about Medicaid expansion and the importance of spreading care and making care available to the populace, and that is very important because disparities are real. They result in increased rates of acute illness as well as chronic disease, increased incidence of violence and injury. And increased rates of complications or bad outcomes when a person does get diagnosed with a problem. There was a study done by Karen Stewart and others entitled "Giving Voice to Black Men: Guidance for Increasing the Likelihood of Having a Usual Source of Care." And in that study, three things came to fore. Those are families promoting healthcare use, and I've heard that said over and over today, the importance of connectedness and having relationships that encourage us toward good health choices. The second was good relationships with, trust of, and empowerment by doctors. That trust factor can be absent sometimes when African Americans are confronted with race issues repetitively, but there has to be some means of building that trust. And one other thing that I thought was very important was positive tone of messaging, and that comes from spouses, from parents, from children, as Mr. Ford said earlier, from our sons and daughters, but also from our friends and neighbors who care about African American men, giving them good advice, but in a positive tone, reaffirming their power to impact their own health. And so I think it is important to recognize that African American men bear primary responsibility for going after health, for choosing health, for seeking the best health. But we also must be cognizant that there are some factors that interrupt that pursuit of health, and that's where collaboration with our family members, but also with persons who are empowered to impact social policy comes to play.
We're going to come back to you in just a moment, Dr. Days, to find out what your organization is doing to try to reach out to Black and brown men. That's Dr. Jacquees Days with the South Carolina AME Health Commissioner. We're also joined by Chris Likes. He is a health consultant. Dr. Jandra McNeely, a member of the South Carolina Optometric Physicians Association Board of Directors. Vince Ford, and a Senior VP of Community Affairs with Prisma Health, and also Representative Terry Alexander and Representative Marvin Pendarvis are co-moderators for this session today as we talk about what Black men need to know and do about their health. Chris and Marvin, I want to go to you because Dr. Days and Vince both mentioned that family is important, and how you, Dr. Days just said, have a conversation with the men in your life. It directly impacts how they move through the health system. So I want to know, what do sisters need to say to brothers to help you take charge of your health? Chris, first you, and then you, Marvin.
I'm not married. I don't have a steady girlfriend at the time. But I'm gonna tell you.
You probably will after this. I'm sure all these people watching.
I'm gonna tell you. Before my mom passed away in 2007, my grandmothers on both sides of my family, they talk with us constantly. We'll talk to me and my brother constantly about making sure you have the proper insurance that you need, making sure that you go to the doctor's office. And then what they say is they just get on us. They don't say anything specifically. Yeah, Chris, you're gonna die, or Chris, you're gonna get sick. She was like, Chris, you got to take care of your health in order to work every day, in order to live your life. You have to make sure that you're eating properly. Now, my parents, I grew up in the 80s and the 90s. My parents didn't always make the right foods for us. When they sent us off to college, which a lot of Black families do, encourage us to go to college, we learned, okay, we might not need to eat fried chicken every day. We might not need to eat, I'm from the country, fatback every day. So we learned by our parents teaching us, especially our mothers, teaching us that we need to be mindful of our health. Go to the doctor. Right? My grandmother still says it. She's 85 years old. Chris Jr., go to the doctor, get yourself checked out. Even if I get a sniffle, just to get your physical, figure out what's going on with you so you can prepare if you do have the pre-diabetes, or if you do have hypertension, because people don't know. I represent the Alzheimer's Association a lot, and the Alzheimer's, we've started, Dr. Days knows this more about this also. We've started at Alzheimer's AME Church International organization is trying to do outreach to Black people in general, because of the things that we've eaten, because of the things that we don't exercise as much, and it causes some of these things cause Alzheimer's. So we want to try to eat as healthy as possible, like Pendarvis said earlier. Try to eat healthier. Try to eat salad sometime. We're not saying take away your steaks and potatoes and all that stuff all the time, but my parents made sure that we try to, once they learned, try to eat a little more healthy.
Yeah.
So, yeah, that's what the women say.
Thanks, Chris. Definitely want to hear about, in just a minute, those efforts that you were doing with the Alzheimer's Association along with Dr. Days. So Marvin, to Chris's point, is it different when your mom or your grandmother says something versus the woman in your life?
Yeah, absolutely. So I've been blessed to be surrounded by some incredible women in my life, from my wife, mother, sisters, aunts, and the great women that I have the pleasure of working with every day. And I'll tell you that, I grew up in a household where my mom cooked up for us, 5 days out of the week. That was important. And what she put on the table really, informed how I viewed food and kind of the consumption that I had and what I took as a young kid. And those are things that I've taken with me as I've gotten older. One of the things that she's always emphasized, is that God gave us these bodies for a reason. This is your temple. and you've got to protect your temple. And what you feed your temple and what you do to your temple is going to dictate, how long you live on this earth. And I want you here for a long time. That's what she would say to my siblings and myself. And that's something that I've always, that's always stuck with me. So for me, it's always about, making sure that I do whatever I can to create healthy habits to live a long life. And so to your question, Trey, absolutely. When you have those conversations with a mother who's in your life who, is emphasizing those things as a young kid, it's going to matter. And then obviously, as a young man who has a wife, and she and I have these conversations quite a bit. And obviously she shows me through her action, right? She's like, this is what we're eating tonight. So that's a big deal. And it creates even healthier habits and makes sure, I'm able to do the things that I do and practicing what I'm preaching and continuing to show those things to our child as he gets older. So it's important, and obviously the women in our life play a critical role in how we're able to lead healthy lifestyle.
Thank you, Representative Pendarvis. We've got just a couple of more minutes. And Terry, I want to end with you, but I do want to go through each panelist and find out what your organizations, what initiatives you have to really tackle the issues around Black men and their health. And Dr. McNeely, I want to start with you, please.
Oh, there we go. Well, I'm really excited to share this. I think that, as we talked about, if you have a doctor that you trust, that you have something in common with. And so our state association and our national association, we're trying to encourage a lot more minority interest in our profession. And so even just recently, recommitted commitment to our historically Black colleges and universities, more scholarships for minority applicants. We're doing a lot more CE, continuing education on diversity and cultural competency, and our state group, and I know we've worked with some of you on here, partnering with community groups and churches, even some of our legislators, to get out into the community. So take the doctors out into the community where there aren't as many providers available. We have optometrists in all but 3 counties, and we're really proud of that, to be out into some of the more rural areas. And that's what we're looking to continue.
All right, thank you, Dr. Days. Dr. Days, you and Mr. Likes are working together between the Alzheimer's Association of South Carolina AME Church. Tell us about some of the collaborations you guys are doing in our community to specifically target Black men.
I appreciate that. But before I do that, I want to go back to the importance of women speaking to men.
Sure.
One of the things that really hit me in the face as a young physician was the statistic that said that men who are married live longer. It speaks the importance of relationship, and trained in the biopsychosocial model of medicine means that we recognize that relationships mean a lot. Harvard Health Publishing has published information about the huge impact that relationship and has on health. In regards to initiatives that we've taken to impact the health of men, the initiatives that we've taken has intended to impact the health of men, but also to impact broadly. Chris and I have crossed paths not just with the Alzheimer's Association, but with the South Carolina Cancer Alliance, from whom I received a report last year that brought me to tears. It basically laid out the reality of African-American men, that we lead the pack in multiple cancers, but also in cancer deaths as a result of that, because those cancers are not caught early enough. And so we have worked with the South Carolina Cancer Alliance. We've worked with Hollins Cancer Center in terms of getting information out there. Information, I think, is important and key, and there are a lot of other things as well. As Chris mentioned earlier, we have done forums about Alzheimer's in collaboration with the Alzheimer's Association. Not only is the AME Church in South Carolina, but the International AME Church is engaged with the Alzheimer's Association and is attempting to get that message out as well. We've had forums in regards to COVID-related realities for African Americans and African American men about vaccinations. In fact, just last week we did a forum with Dr. Linda Bell, and we've done forums with persons like Dr. Thaddeus Bell, who has an organization that he started called Closing the Gap in Healthcare, seeing the health disparities in our state. And so when I first came onto the task of leading the health ministry of the 510 plus churches here in South Carolina, I implemented five commissions, which I thought would cover every area. Two of those commissions are specific to personal health choices, and that is preventative health and early intervention. And so we have collaborated broadly to make sure that those things are impacting the health of men. This year, I implemented something different. I implemented a council overview. And one of the councils that I developed was Men's Health Council, where there's a gentleman who is a part of the ministry who looks at every area of health that we tackle to see whether we are keeping in mind African American men and other men of color, and if not, to implement something to affect those persons as well. Bishop Green continues to forge new alliances across the state because his intentions are to make a positive impact upon not only members of the African Methodist Episcopal Church, but to make positive impacts on families, on communities, and across the state of South Carolina. And so we're excited about the collaborations we have forged, but we want to forge even more to impact health of African American men, but also people across the state.
Awesome. Chris, do you want to chime in? Or did Dr. Days just summarize it all?
Dr. Days basically summarized it all.
Okay.
All I'll say is I am going out with the Alzheimer's Association to individual churches and speaking to them about resources that the Alzheimer's Association can give or they've connected with, so people can understand that there are resources out here to help us with this terrible, terrible disease. So it's but other than that, Dr. Day summed it up perfectly.
Awesome. Want to make sure that all of you put your resources, websites, links to the right in the private chat so we can make sure that our viewers get access to all of this information. Vince, what about Prisma Health? Are there any specific initiatives related to African American men and their health?
Absolutely. In fact, all across the board. I mean, all the chronic health issues, all the preventative issues. So there are opportunities for African American men, women, and in the entire population to get access to. And all you have to do is go on prismahealth.org and go to the community health section, and you can see the services that we provide. But Trey, I just want to add one last point. To me, the most important thing in my life is my faith. But second to that is my health and well-being. And I want to encourage men of faith and other men to take responsibility for your health and well-being. I want to encourage and challenge Terry Alexander, Marvin Pendaris, Ms. Hennigan, and all the other members of the Legislative Black Caucus for the phenomenal work that they're doing. These caucuses, Terry has been at it now for years, but we've got to make sure that we hold systems responsible and accountable for these different outcomes. So it's going to be two-sided. We want the systems to do their part, but I also want to encourage African-American men to do their part. If you read the book Blue Zones, where people not only live longer and better, one of the things that happens is the people in those communities take responsibility for their own life and health, and they do pretty simple things like walk, like movement, like have community meetings, and things like that help them not only live longer, but better. Thanks to the Legislative Black Caucus, to Prisma Health, and others for having this forum. What a phenomenal day so far, and I'm looking forward to the others that are to come.
Thank you so much, Vince. Representative Terry Alexander, I'm going to give you the final word, man. What needs to happen? We've heard all of this great information. There are resources available. Women have been given our orders on how to communicate with men. What else needs to happen? What are your final words, sir?
Well, a couple of things. Thank you very much again, Trey and Vince and all of the presenters. Ms. McNeely, I want to see you sometime next week. Let's talk about that diabetic thing, okay? And Brother Mays, Dave, my wife and I had that conversation about that poll where if you're married and you live long. I told my wife, I said, I must be a female-driven poll. She's not here, so I can say that right now. But you know, one thing that we have to do, Trey, and we've had this conversation, and we constantly have this conversation, is continue to have a conversation. Continue to talk about men's health. You know, you mentioned that Vince and I are almost like the senior members here. Now, me and my boys, we talk about our health more than we did when I was 31 $10.
Right.
You know what I mean? Because I thought I was going to live forever.
Right.
So the boys and I, we are constantly sharing. We're constantly talking about, man,
That's
how you
good.
feel? You know, how you feel? Like, man, I woke up, this was going on, that was going on, and we share different information. So I think it's incumbent. I think it's that twofold. We have to take some responsibilities, as Vince said, and then we also have to make sure and keep the system trusting that when we do approach them, that we're going to get the best care that we can. I did chaplaincy work past the days over at McLeod for years, and you know, and I can tell the difference when I go into an African American room, and then when I go into other folks' rooms. I can tell by the level of care, the level of conversation, and it is true. So we have to keep the system accountable as well as ourselves, and it's really on us. You know, it's on us to keep the systems accountable, and it's also on us to maintain some type of reasonable sense of our health. This is our body. It is the temple. We've been endowed. We've got certain responsibilities, and we have to share those responsibilities. We have to keep talking about those responsibilities. And you know, the brothers have to get together and talk. You know, we can't do this taking care of our bodies as an activity.
Right.
There must be an ongoing process, Dr. Days, an ongoing process. Those things that the AME churches do, that's constant. And the more you talk about it, the more better results we're going to come. I remember some years ago, and you all can attest to this, and that when women's breast cancer was so high, and what happened? The conversation started. And the more they talk about it, the more attention was placed. Now those numbers are coming down for prevention, for testing, all the whole thing. Now, and we have to do the same thing with Black men. We have to continue to talk about it. I just heard the other day from a doctor in Orangeburg, Brother Vince. They said prostate cancer in Orangeburg amongst Black men is one of the highest in the country. So therefore, we need a conversation, an ongoing conversation, a constant conversation about Black men's health, and not just an activity, but a process. And we're going to be putting together some processes, particularly here in Florence, Brother Chris, about Black men's health on a continuous basis. We've been talking to some healthcare providers in terms of how that's going to look and how that's going to operate. And we're moving. We're moving in that regard. We have to have this conversation on a constant matter, on a constant term.
Absolutely.
I'll leave it there.
Thank you, State Representative Reverend Terry Alexander, State Representative Attorney Marvin Pendarvis, along with health consultant Chris Likes, Dr. Jandra McNeely, member of the South Carolina Optometrics Physicians Association, also Dr. Jacquees Days, South Carolina AME Health Commissioner, and Vince Ford, Senior VP, Community Affairs of Prisma Health. Lady and gentlemen, thank you all so much for joining us today for the Prisma Health and South Carolina Legislative Black Caucus Minority Health Summit, as we talked today about what Black men need to know about their health. Don't forget to put your links and the information in the private chat, and we will get it out to each and every viewer that wants the information. Please continue to like and share and post this important conversation as we continue the conversation with our final panel in just a few minutes, COVID-19 vaccination. Where are we now? What to expect? And where are we going? That's next on the 2021 Minority Health Summit from Prisma Health and the South Carolina Legislative Black Caucus. Thank you all so much.
The South Carolina Legislative Black Caucus was founded in 1975 with the mission to improve the quality of life for Black and minority communities in South Carolina. Since its founding under the leadership of Judge Ernest Finney Jr., the caucus has been the catalyst behind significant legislative action and policy changes in South Carolina that brought efforts of justice and fairness for all South Carolinians. Caucus efforts have led to state statute requiring consideration of minority businesses in the process of awarding state contracts, the creation of the Governor's Office for Small and Minority Businesses, the South Carolina Commission of Minority Affairs, and the state's Human Affairs Commission. The caucus is currently comprised of 45 members, including 12 state senators and 33 members of the South Carolina House of Representatives. In January 2021, State Representative Patricia Hennigan assumed the role of chair of the caucus, marking the third woman to be elected to lead the historic organization. Chair Hennigan has announced an active and comprehensive plan for the caucus that centers on increasing overall exposure and opportunities for minority communities across South Carolina. The South Carolina Legislative Black Caucus remains committed to its founding motto, "Like limbs, we reach toward the sun, but feed from a common root." The caucus remains readily available to serve the citizens of South Carolina, continuously fighting for justice and fairness.
Join our team, the First Choice Fit team. We eat right, stay active, and go for our annual well visit. These three things help make sure you're growing up healthy and strong. Be First Choice Fit like me, Marcus Lattimore.
Madam Chair, Representative Hennigan, Representative Alexander, members of the Legislative Black Caucus, and attendees of the summit, it is my honor and privilege to bring you greetings from First Choice by Select Health of South Carolina. My name is Courtney Thompson, and I'm the Market President for First Choice by Select Health, the state's oldest and largest Medicaid managed care plan, where we have a mission of helping people get care, stay well, and build healthy communities. We wanted to thank you for your ongoing support of the Medicaid program in South Carolina. We also wanted to stand with you in your mission of addressing health equity by reducing barriers to care and addressing social determinants of health. In that spirit, we recently sponsored a new training from the March of Dimes called Breaking Through Bias in Maternal Care, which is aimed at helping develop strategies to reduce maternal bias and improve cultural equity within organizations. If you're interested, please contact Evan Owens and he'll connect you with First Choice. Thank you for your leadership and your partnership, and we very much look forward to working with you in the coming months to continue to improve health outcomes across the state of South Carolina. I hope you enjoy the summit, and thank you for the opportunity to say hello.
Hey, South Carolina, you can make a choice for your Medicaid health plan. Choose Healthy Blue. With Healthy Blue, your whole family is covered for free or low-cost checkups and prescriptions, plus eye exams and glasses for kids and adults. Get all this and more from a plan backed by the Cross and Shield. The choice is easy. Get Healthy Blue now at choosehealthyblue.com/SC and get more from Medicaid.
You're watching the 2021 Minority Health Summit, sponsored by the South Carolina Legislative Black Caucus and Prisma Health. This annual event brings together SLCBC members, health organizations, professionals, and leaders from across the state to provide information and conversations focused on health issues impacting South Carolina's Black and minority communities. Our final panel, COVID-19 vaccination. Where are we now? What to expect? And where are we going? Featuring Dr. Linda Bell. She serves as the state of South Carolina lead epidemiologist. Dr. Bell has been with the South Carolina Department of Health and Environmental Control for 26 years and is an expert in infectious diseases, including the coronavirus. Due to the pandemic, Dr. Bell has become a household name across the state of South Carolina. Dr. Edward Simmer is the newly named director of the South Carolina Department of Health and Environmental Control. Prior to being named to his current position this year, Dr. Simmer served over 30 years in active duty in the United States Navy, maintained an active clinical practice as a forensic and general psychiatrist, and has been an expert witness in numerous court-martials worldwide. Beth Morgan is a registered nurse and serves as the Director of Clinical Affairs and Workforce at the South Carolina Hospital Association. And co-moderators for this session, Senator Mia McLeod, elected to the South Carolina State Senate in 2016. She represents District 22, which covers Kershaw and Richland counties. Currently, Senator McLeod serves on the Rules, Judiciary, Medical Affairs, Family and Veteran Services, and the Corrections and Peniology Committees in the Senate. And Dr. Representative Ivory Thigpen. He was elected to the South Carolina House of Representatives in 2016, representing District 79, which covers Richland County. Currently, he serves on the Judiciary Committee and the South Carolina House. Aside from his legislative duties, Representative Thigpen is also a pastor and a chiropractic physician. Please welcome the panelists for our final session today, COVID-19 vaccination. Where are we now? Where are we going? What to expect?
Thank you again so much for joining us for the South Carolina Legislative Black Caucus and Prisma Health 2021 Minority Health Summit. My name is Trey Taylor. I want to remind you to please post and share this important conversation out so we can get the message out on your social media outlets. We're going to talk about some important issues we have been throughout the day. And today, of course, it's COVID-19. We're talking about the vaccinations. Where are we? Where are we going? And what to expect. I want to thank all of our panelists for joining us today, and my co-moderator, Senator Mia McLeod, and Representative Dr. Ivory Thigpen, and of course, all of our panelists. Thank you guys so much for joining us. I appreciate it. So let's get into the conversation. We're going to ask South Carolina's Dr. Fauci. Dr. Bell, listen, what are your thoughts on where are we? Where are we with the vaccine specifically?
Well, with the vaccine rollout in South Carolina, we started administering our first doses towards the last 2 weeks of December. And currently we have what we define as fully vaccinated, about 30% of the individuals in South Carolina. And we have about 40% of South Carolinians who have received at least one dose. That 30% is good progress, but in terms of our long-term goal to reach herd immunity of about 70 to 80%, that tells us how far we have to go to get to that point where we have sufficient immunity from the vaccinations in the population to really help us move to where we can safely start relaxing all of the recommended prevention measures.
Right, so we're 30%. Now, are these fully vaccinated people?
The 30% are people that we define as fully vaccinated.
Okay, so we know that we've heard in the news that there's a huge portion of the population who've only gotten their first dose and not their second dose. Can you talk a little bit about how that impacts them and us who are fully vaccinated? Are they okay, half vaccinated, or?
No, that we strongly recommend that individuals who are vaccinated follow the vaccine manufacturer's recommendation for what we consider a complete course. So if they're receiving the Pfizer or Moderna vaccine, to achieve that maximum immunity, they should definitely get the second dose on the recommended schedule. Otherwise, we leave people who are only partially protected.
Right. So you're saying they're just partially protected. So does that mean they're 50% protected? Or, I'm just trying to understand and trying to really find out. And Dr. Simmer and Ms. Morgan, you can jump in on the conversation too. How do we get people to understand that half vaccinated is, would you say, really not vaccinated at all?
Well,
Dr. Bell, go ahead, Dr. Bell, you were muted.
Okay. Yes. So partially vaccinated means that people have not obtained the full benefit of the vaccine. Now, this varies from one person to another. We can't say that partially vaccinated means 50% protection because it does vary from one to another. But the way the vaccine was tested in clinical trials, at least those two that have a recommended 2-dose schedule, and when we report out the vaccine efficacy in the range of about 95% for both of those two products, well, people won't achieve that level of immunity if they only get the single dose. So there is some partial protection, but we don't want to see cases of people who are having, we don't even consider these breakthrough infections because they're not even fully vaccinated. So they're not getting the full benefit of the prevention of severe disease, the avoidance of hospitalizations maximally. And how we can help people understand that is something that I hope we can all work on here, is that, the vaccines were not recommended, those two particular products, as a single dose.
Right. Mia, did you have your hand up? I saw your hand up. I didn't know if you had a comment.
I did.
Oh, we can't hear you. I think you have. Oh, yeah, we lost Mia. We've got a bit of a bad connection. Until Mia comes back, Ms. Morgan, let me ask you, as working with the South Carolina Hospital Association, what are the challenges you all are facing as far as infiltrating some of our rural and minority communities as far as vaccinations are concerned?
Yeah, thanks, Trey. So, I think the main thing we focus on is engaging our chief diversity officers at each of our hospitals. These are the men and women that have the expertise. They know their communities, and they're the ones that can message these things in a way that minority communities, understand and will relate to. And so for those kind of things, we rely on the experts. We are not the experts at the hospital association. Those are our members. And so we do everything we can to highlight them and let them showcase their work.
Right. All right, Dr. Simmer, let me ask you the same question then. At DHEC, as really kind of leading the charge for vaccinations along with, the government assistance, how are you all kind of tackling the issues that have been happening in our rural and minority communities? Vaccine access, obviously, registering for a vaccine when internet is a big issue in many of those communities.
No, I think that's a great question, and we're doing several things. First of all, pretty much all of our vaccine clinics now, you can just walk in and get a vaccine. Right. So you don't need an internet, you don't need to make a phone call, show up, we'll vaccinate you. So I think that's made it easier. We're also working with a number of our private partners who have mobile units and that can go out into the community and take vaccine almost anywhere and provide it through that. We're also working with a number of community partners, local officials, spiritual groups. We work very closely, for example, with the AME Church, which I think is very important. With the goal of offering the vaccine at just about every spiritual group who'd like us to come in the state. Now, we haven't gotten there yet, but we're certainly working on that. So we are working very closely with community partners, with our own staff and others to make sure that we can get the vaccine to people rather than asking them to come to us, and eliminating the barriers like making an appointment, like having to drive somewhere to get the vaccine. So, our goal is to be in every community, especially in the rural areas and the underserved areas. We're working with a number of the members of the Hospital Association on that. But also a lot of private partners, private physicians, and pharmacists to get the vaccine out to every single person who'd like to get it.
All right. We are talking to Dr. Edward Simmer. He's South Carolina Department of Health and Environmental Control Director, also Beth Morgan, Director of Clinical Affairs and Workforce with the South Carolina Hospital Association. Also, Representative Ivory Thigpen joins us as a member of the South Carolina Legislative Black Caucus, and Dr. Linda Bell, South Carolina State epidemiologist. Dr. Bell, you talked at the beginning about the 30% of people that are vaccinated, which means 70% of South Carolinians are not vaccinated. What are the current cases of COVID? Obviously, they're going down, but can you tell us about some of those numbers now?
Yes, Trey, thank you. So we have seen a dramatic decline from the peak of case reports that we were experiencing around the first part of the year. But, the word of caution is that decline has come to a level of where we initially began to see disease surges in this state at the beginning of the pandemic. So where we are now is certainly not our goal. We're still seeing hundreds of cases reported per day. We're still having deaths reported. We're actually seeing a bit of a shift in the age group. We're seeing more the proportion of younger people who are infected is increasing, and hospitalizations among younger people are increasing. So when we look at some of these indicators and where we want to be, we're moving in a good direction. But we're at a point now where this is an opportunity. It's a window of opportunity. If we press on and we much more rapidly increase our vaccination coverage, that's going to do us a great deal to suppress that curve even further. So where we are now is not our goal. We're seeing a bit of a leveling off. But in public health, we don't just monitor, do surveillance for the disease locally. We also look at what's going on nationally and internationally. And so when we see some concerning things, especially internationally at this time, where there are certain areas who were pretty successful in suppressing their curve, and then they had a dramatic resurgence, we understand that we continue to run that risk. We continue to have the risk of importation. So our goal to keep that trend going down and down is that we really have to get our vaccination coverage up as quickly as possible. And I do want to stress the point that you made earlier that we strongly encourage everyone who's received one dose and we're supposed to get two, they need to complete that series.
Yeah. So it's interesting what Dr. Bell just said, Dr. Simmer, which is that it seems the statistics of younger people are growing as far as contracting the virus and hospitalizations. How do we tackle now? Well, first, why? And then how do we tackle, dealing with young people who are invincible, so they think? If we can unmute Dr. Simmer's mic.
Okay, I think we're good now. So yes, good question. And sometimes they do think they're invincible and aren't going to be susceptible to something like COVID. Of course, what we know is that although the worst cases of COVID are more common in folks who are older, certainly young people can get COVID, can die from COVID, tragically. And it has happened many times, even in the state of South Carolina. I think the way we reach the younger population is we need to communicate to them through the ways they communicate. So we need to reach out through social media. We need to reach out through people that they recognize and respect, who are often younger people themselves. And we are working with a number of people who can get the word out to them. Sometimes that's going to be a teacher. Sometimes we can work through their parents. Sometimes it's a pop figure that they like and respect. So we're working very hard on that. Again, making it easy for them to get the vaccine. So we're going to be bringing vaccine and having vaccine tables at a lot of the festivals and fairs, some of our state parks, because that's where a lot of young people congregate. That's where people go on the weekends. So we're hoping we can catch more of them by going to where they're at. Instead of asking them to come to a vaccine event, let's take the vaccine to their events and offer it there. And I think that will make a difference and make it more likely that they'll get vaccinated. The other thing is that, of course, it looks like it will be before the end of summer, we'll probably have the vaccine approved for children as young as 12. So then we can certainly offer it. And some schools are already doing this, offer it through the schools. and the school nurse or someone at the school can provide it to them with the parents' consent. So I think once we have the vaccine available for children as young as 12, that's also going to make getting more of our younger population vaccinated a little bit easier.
Yeah, I was going to talk about that a little bit later about, where we are with the vaccine as far as younger children. But I actually love your idea of taking it where people are. And I guess we are starting to open back up with festivals and fairs, as you say. And I absolutely love that. We've got to start thinking out of the box and figure out where the underserved or the vulnerable population is and take it to where they are. Beth, let me ask you about the budget process, if I may. I want to know what's the goal? The budget process. What's in the Senate? What's the Senate version related to this topic?
So I would have to defer to my colleagues on this one. I don't know the language on that.
Okay. All right. So let me bring you into the conversation, Representative Thigpen. What can the South Carolina Legislative Black Caucus, or what can lawmakers do to help disseminate the information that's needed to the groups that need the information about the vaccine? 30% is not great.
Right. I think information and access to information still is our primary goal. As elected officials, we have contacts and networks within our various districts that should allow us to disseminate the information. I think we also have to bolster confidence in letting people know that, the vaccine is safe, that persons can take it, that we are encouraging it to be taken. I think the last piece is probably the most practical one, which is telling people that really we're in a new norm. I know that we want to get back to doing things the way that we once did, but the reality of it is that we're not out of this pandemic yet.
Right.
So we still have to promote the wearing of masks, the washing of hands, the practicing of physical distancing. Even though we want to stay socially connected, we still want to have physical distancing when we're gathering together. I think a lot of people, just to be quite frank, are a little tired and fatigued from having to be many persons isolated.
Okay, thank you, Representative Ivory Thigpen. Lately, a couple of weeks ago, of course, we saw a halt, some concerns in the J&J vaccine. I want to get your opinion, Dr. Bell, on what was the problem? And it's back on the market now. In your opinion, should it be back on the market?
Well, I absolutely do think it should be back on the market. That is a vaccine that actually has an excellent profile in effectiveness, and as compared to other vaccines and even other medications, it has an excellent safety profile. Now, in the United States and through the CDC and vaccine manufacturers, it has been implemented one of the most rigorous surveillance systems for potential adverse events associated with vaccines. And it's through that surveillance that they were actually able to detect these very rare but serious clotting events that were associated with the J&J vaccine. And to put that into perspective, there were approximately 15 cases, I think, they've identified so far, after over 7 million doses of that particular vaccine were administered. So that's an extremely rare event. And the other thing I want to put in perspective, though, is because I certainly appreciate the questions about the vaccine, questions about the safety, but I always hope that those questions are asked in the context of the disease itself. So if you were to look at the occurrence of severe clotting events associated with being infected with COVID, you would find orders of magnitude higher. That when we talk about maybe 2 cases per million of that specific rare clotting event associated with the J&J vaccine, many people may not be aware that the CDC has estimated there are about 165,000 clotting events associated per million case of COVID-19. So again, the vaccine, in that particular J&J vaccine, the benefits of that vaccine really far outweigh any small risks of safety, and really far outweigh the risk of the disease itself. It has, one of the great things about that vaccine is that in a single dose, you will get that immunity 2 weeks after you had that single dose. So you can get immunity much more quickly than you can with the 2-dose series of the other 2 vaccines. So all 3 products that are currently available are actually excellent choices in preventing severe disease and hospitalizations. And so I do think that it's a good thing that the pause is over and that J&J is back on the market.
Beth, if I can,
Okay,
go ahead. Go ahead,
Well,
Dr. Bell.
I was going to pick up right where Dr. Bell left off. I think the more options we have, the better outcomes we have, particularly when you know that there's a population of people who have taken 1 dose and have not yet taken their second dose. Being able to provide this protection in 1 dose, I think will be a lot more attractive and convenient for a lot more of the population. So I definitely think it should be a part of the options that we have in offering vaccination to the public. And once again, I think Dr. Bell did an excellent job of putting it in proper perspective and context. Because like so many times, we see, incidents, but they're not put in the proper context. And so when we look at it, it really is a small occurrence. I think both DHEC and all persons and institutes that have been administering this vaccine have been very proactive and been very watchful and vigilant in ensuring that even after the person has had the vaccine administered, that there's a period that they're, watched to ensure that there aren't any immediate adverse reactions. So I think we have to promote confidence in it, and again, seek really hard to get to that herd immunity. Thank you.
Yeah, thank you so much. We welcome again Senator Mia McLeod to the summit, the Minority Health Summit from the South Carolina Legislative Black Caucus and Prisma Health. To Dr. Bell's point, Beth and Dr. Simmer, can either of you talk about if you saw any additional vaccine hesitancy due to the J&J pause, and now that it's re-entered the vaccine distribution phase? Either of you can comment.
From the hospital side, we haven't heard of anything outstanding with the Johnson & Johnson vaccine. Certainly, our hospitals aren't the major providers for that type of vaccine. But I'll echo obviously what Dr. Bell has said, the fact that it's 1 dose and that you can store it in a fridge. This is just a valuable tool for our arsenal. But as far as the healthcare community in the acute care setting, we haven't heard of anything.
Great. And Dr. Simmer, how are you, if there's anything out there, how are you all tackling or working toward decreasing any concerns people may have?
Sure. Well, certainly I think people have valid concerns. They have questions. They, how's this vaccine going to work? What are the side effects? They may have seen something on the internet or heard it on the radio. There's a lot of misinformation out there. So I think one of the things we definitely are trying to do is get the correct information into the hands of people. One way we do that is certainly with our websites, cdc.gov and dhec.sc.gov, our website, are 2 great information sources for information. But we're also putting out printed materials, doing sessions like this. But we're also training a lot of our community partners so they can answer some of those questions. And talk with people who trust them about this is how the vaccine works. It's very, very safe. It's been given, I think, now to 200 million people, and the risk of serious side effects is very small, and it works. So I think by training a lot of folks to help carry the message, and also making sure people have access to accurate information, is how we're going to overcome that. I will say we have not seen a lot of people concerned about the J&J vaccine. Actually, we've had a lot, since it's become available, we've had a lot of people asking for it. That seems to be a very popular option, almost certainly because it is a single dose.
Yeah. You talked a little bit a couple of minutes ago about children and vaccinations. I want to bring that back up because right now, only those 16 and over can get vaccinated. Where are we in the research for those 16 and under to get vaccinated? And is there a need for children to be vaccinated?
So to answer your second question, yes, there is a need for children to be vaccinated. Although children are less likely to get severe COVID, they can. Some children have died from COVID. But they can also spread COVID. So if they catch COVID, say at school, and then they go home, and there's maybe a grandparent at home or someone with a serious medical condition who is at greater risk for having bad outcomes from COVID, they can spread it to them. So yes, I think it's very important we vaccinate our children too. And right now there have been the vaccine manufacturers have completed studies on children 12 and older. Those studies have given very good results, and they expect that they'll be presenting those to the FDA here in the very near future to hopefully extend the age limit for vaccines down to age 12. They are now just starting to do studies. Actually, Moderna, I believe, is working in Connecticut now with children as young as 6 months of age. Now, that's obviously a little bit farther away. We'll have to see what the results are. But I think we'll see the vaccine approved for children as young as 12 before the start of next school year, very likely. And then hopefully children much younger than that, perhaps by the end of the year or early next year.
So the question then is masks or no masks for kids?
Yes, that is the question. And I will tell you that
And what is the answer?
Well, yeah, that's fair. And it's a great question. And certainly we respect that, the governor has concerns about that, and he has to take a number of factors into account when he makes a decision. From the public health standpoint, DHEC's recommendation is that children continue to wear masks in schools, at least for the remainder of this school year. We think that's very important. We think that will help prevent transmission of the disease and all the bad things that come with that. And certainly I believe, we've talked with the schools, and they, I believe, are in agreement with that. So for right now, we recommend that schools continue to require children to wear masks until the end of the school year.
All right, that's Dr. Edward Simmers, South Carolina Department of Health and Environmental Control Director. We're also joined by Beth Morgan, Director of Clinical Affairs and Workforce at South Carolina Hospital Association, Dr. Linda Bell, the South Carolina State Epidemiologist, and Senator Mia McLeod and Representative Dr. Ivory Thigpen also join us for the South Carolina Legislative Black Caucus and Prisma Health 2021 Minority Health Summit. I'm Trey Taylor. Please continue to post and share this important conversation out so that we can spread factual information, because that seems to be one of the biggest issues with, just disseminating correct information about the virus. Dr. Bell, is the vaccine enough? What else should and could be done to protect people from the virus and its variants? And I do want to talk about the variants too.
Yes, thank you, Trey. And the vaccine is certainly our greatest tool. The beauty of vaccinations is that it gives your body the ability to respond and fight off the virus for unexpected exposures. But we can take other measures. And while we have not reached our goal of that herd immunity, there are other measures that as Dr. Simmer has said, the use of masks are highly effective. Of course, you have to use those to predict when you might become exposed, and continuing the physical distancing. If you are in crowds, especially indoors or in large groups, then the risk of spread remains, because we still have a relatively high level of disease activity in our communities. So all of those additional measures, and certainly when they're used consistently, the masks, plus the physical distancing, plus avoidance of contact when possible, those are still needed when we still have, so many people in the population who are not yet vaccinated. And we just don't want people to forget about, while those are tools that would require some thought put into it. It doesn't just give your body the ability to respond without you having to do anything. Again, the beauty of the vaccines, but we still need those. They still work. And so as we're running this balance between getting people vaccinated as quickly as possible, just don't want people to forget about the importance of the availability of those other measures, really, for everyone.
Yeah. Senator McLeod, I want to get you in the conversation, if that's okay. We talked a little bit about the budget and what the legislative responsibility and process is to disseminate correct information. Can you chime in, as I know you guys are working to finish up the budget, and how those funds can and will be allocated to tackle vaccine hesitancy and vaccine information, and your mic is muted. If you can unmute your mic, thank you. Can we unmute her mic, please? I think you're unmuted now. Thank you.
Okay, sure. One of the things that I think is going to be really helpful, we just debated the budget in the Senate this week. And one of the things that the Minority Caucus tried to focus on is getting our young people vaccinated. So there was an amendment put up that I think was successful. And that would provide a $100 incentive for young people, I think between the ages of 16 to 35, who complete their vaccinations, and a $250 scholarship for students who attend South Carolina public institutions of higher learning, colleges and universities in South Carolina. So with those two incentives, I think that we will, I mean, that's certainly the beginning of hopefully getting more young people vaccinated and getting them more interested. I think West Virginia might be the only, one of the states, I won't say the only state, but one of the states that started an incentive program like that. And so we are looking to do that here in South Carolina as well.
Okay, great. Those sound like great initiatives. We hear about the booster shot. We hear that, when you talk, Dr. Bell and Dr. Simmer, about, it's dealing with COVID and what needs to happen as far as the vaccination. We also hear that there may need to be a booster shot. We may need to get revaccinated at some point. Do we know if that is the fact? And if so, when will that have to happen? Dr. Simmer, do you want to chime in?
I'll let Dr. Simmer take that one.
Okay. Thanks, Dr. Bell. I think we don't know for sure yet if a booster shot will be needed, but it looks likely. Obviously this is a relatively new vaccine, so we don't know for sure how long it's effective. But based on the studies so far, an annual booster looks like that's probably going to be coming. And I think the way we manage that is very much the way we do flu vaccine. Every year you get your flu vaccine and that protects you hopefully for the next year. I think that's very likely going to be what we do with COVID as well. Probably through much the same mechanism that you go to the grocery store and while you're shopping, you can get your flu vaccine. Well, you go to the grocery store, you can get your COVID vaccine too, or your doctor's office, or a clinic wherever you get your health care. But we want to make it as easy as possible for people to get those. I think we'll have to wait and see if the research shows that it's possible to do flu and COVID together. Right now, we recommend that you not get another vaccine with the COVID vaccine. But I think we are very hopeful that we'll be able to develop a booster that could be administered at the same time with the flu vaccine. Because if we could do that, then it would be very easy. You go in, you get both at the same time, and you're done for another year. And I think that's very likely what we'll be seeing going forward.
So, Dr. Simmer, so you said it looks like it's going to be annually.
Yes, I think that's most likely.
Will you have to get the same type of shot? Like if you got the Moderna, you need the Moderna. If you got the J&J, you need to get the J&J as a booster. Will you need to stick with the same type?
Yeah, we don't know for sure. I think probably not. But we'll have to wait and see how this works out and how they set up the booster shots. We are certainly hopeful that you will not have to stay with the same brand indefinitely.
Mm-hmm. We've got a couple of more minutes, and I definitely want to ask. So, Dr. Bell, is COVID here to stay? If as Dr. Simmer says, it looks like we're going to have to get a booster annually. So that means we've got to deal with allergies, flu, and COVID for the rest of our lives.
Yes, that's an excellent question, and I think it's unlikely that we would be able to eliminate or eradicate the virus that causes COVID-19. What we're hoping to see is that we can bring it to a low level of transmission. We know that many other vaccine preventable diseases do continue to circulate in communities, but at low levels. So that the hope is that we will be able to suppress it to the point where we may see occasional outbreaks or pockets of cases, but that we will get it under much better control than what we're seeing now, which is really widespread, just continuous transmission at a moderately high level. So I think we should prepare ourselves for the fact that, yes, we may be seeing this year after year. Unfortunately, this doesn't look like a seasonal disease like flu is, so we may be experiencing this year round. And so there are many things that we have yet to learn about this, but I think it's unlikely that we can fully eliminate.
Wow. Beth, as we close, I want to know if you have anything that you want to share from the South Carolina Hospital Association standpoint. Can we unmute Beth Morgan's mic, please? Thank you.
I think, Dr. Simmer and Dr. Bell have said this as well, but I think we have a really great chance to rethink the way we deliver care to the citizens of South Carolina. The COVID vaccine kind of changed the game, and historically our hospitals and doctors' offices, they aren't as engaged with public health. And this has opened up the door for them to be more engaged in public health. How great would it be if we had healthcare workers that could go door to door, giving vaccines to anybody that wanted them? And so I think, those are the kind of things our hospitals are working on and trying to engage their communities. And, unfortunately, that model of preventative care, it costs money, it costs manpower and transportation. And these are the things, again, that continue to work on. But that idea of that if you build it, they will come, that's changed. We need to go meet people where they are.
Yeah. And is that something the Hospital Association is working on with your hospitals, particularly as it relates to minority care? And hesitancy, shifting the way hospitals do their jobs?
It's certainly on top of mind for them. Once we've seen this sort of demand for the vaccine sort of lessening here lately, and that has engaged these communities these hospitals to reach out to their communities and figure out how to reach these people. Certainly the Department of Health, the DHEC care panels are involved with our hospitals and doing everything they can to reach out to these communities. But again, I think just like everyone else has said, we have to go meet people where they are. We can't rely on them to come to us anymore.
Absolutely. And I have to tell you, Beth, it's a little frustrating because this is not new. I mean, there have been disparities in Black and brown communities for years and years and years. So, the hope is, since the pandemic obviously opened some people's eyes that personally should have already been open, hopefully this will, motivate, hospitals and healthcare providers to do their jobs a little bit different. Mia and Ivory, do you guys have anything to share as we close out the session?
Sure. Can you hear me?
Yes.
Okay. Yeah, thanks. This is a really important discussion. I'm glad we've had it. One of the things that I'd just like to highlight is the fact that in the African American community, there's a lot of misinformation and the lack of information. And I think one of the things that we really need to do in the state is to expand Medicaid so that our folks in the African American communities and rural communities as well can have local hospitals and doctors that they trust. But I think at the end of the day, until we do that, we've just got to continue to have the conversations. And that's why this one is so important, because when they hear from people, when we hear from each other and people that we can really trust and depend on, it makes a difference. And I think that's keep having these conversations and discussions.
Thank you, Senator McLeod. Dr. Thigpen, do you have a closing comment?
Yeah, I'll try to be brief. I think as we talk about vaccination, we cannot talk about it without talking about health disparities in African American and minority communities. And access to care, funding for care still are just paramount. I think as we talk to individuals and encourage them to be more health minded, because I think one of the things that we haven't really talked about was just period, not only the practices of, wearing a mask and physically distancing, but also persons being as healthy and as active as they can be. A body that is healthy and active is much better able to defend itself against, viruses and bacteria and things that they encounter. And so I think when you also talk about, and I think the first panel did a really good job earlier today, just talking about just disparities in general in healthcare and just the challenges we face in minority communities. Because, even if you are more educated, even if you do have a higher income level, there still are some hereditary factors. There still are environmental factors. There are a lot of things that I think it's a full and multifaceted approach to really trying to lower that or decrease that gap. So I'm grateful for this panel. I'm grateful for this health summit. Kudos to those who put it together and the great information that has been given. Thank you.
Thank you, Dr. Thigpen. Before we leave, we've got three quick questions for Dr. Bell and one question for Ms. Morgan. To travel or not to travel if you're fully vaccinated, Dr. Bell? Can we unmute her mic, please? Thank you.
So if individuals choose to travel, they should be very mindful of the risks. There are many ways to protect themselves. Certainly, it's really recommended that they be fully vaccinated before they travel. But again, even people who are fully vaccinated, when they're in public places like airports, they still must wear masks, practice the physical distancing. After individuals travel, when they return home, we recommend that they actually be tested. Even if they've been vaccinated. I believe that's what the CDC is recommending. I might need to double check on that. But the risk of exposure to so many people when you're traveling and on airports, and the risk of that virus circulating, there is still a threat there. So the CDC has on its website travel recommendations, what is recommended prior to travel and after travel. But certainly they need to monitor for symptoms and for the 7 days after they've traveled. So there is still some risk there. But once again, as we get more and more people vaccinated, there will be more opportunities for us all to do the things that we have been accustomed to doing in years past more safely.
Awesome. Any additional do's and don'ts for the fully vaccinated, Dr. Simmer? Can we get his mic unmuted? There you go. Thank you.
Okay, so yes, I think certainly people who've been vaccinated should still wear masks, should still socially distance when they're indoors, or if they're in a crowded outdoor place. So I think those precautions still should be in place. And I think the best thing people who've been vaccinated can do is encourage family, friends, and others to get vaccinated too, so the benefit of vaccinations gets shared with everyone. So I think if we can get the folks who've been vaccinated to do those things, we'll be in good shape.
And quickly, Beth, we had a viewer that wants to know, how does the South Carolina Hospital Association play in the recovery efforts for the hospitals?
Since we are the support system for all of the hospitals in the state, nearly 100, and throughout the pandemic, we have been there to help with acquiring PPE and testing strategies and treatment areas. Even when we were worried about not having enough ventilators, this is where we had an ethics committee that came in and talked about those things. Luckily, we didn't have that issue in South Carolina, which was wonderful. When it comes to vaccines, we're the ones at the table that are advocating for them to receive more or less, or helping. We had one, I'll share this really quick story. We had one hospital reach out to us and say, we didn't get as many vaccines as we thought. This was several months ago. We didn't get as many vaccines as we thought this week. We have 200 patients that I'm going to have to cancel their second appointments for. This is devastating. And so we then reached out to another hospital system and I said, hey, you got a couple hundred vaccines laying around? And they, without hesitation, transferred those doses to another hospital, so that those appointments didn't have to get canceled. And so that collaborative spirit was on display fully with our hospital systems.
Awesome. And finally, Dr. Bell, have you ever met Dr. Fauci? You're our Dr. Fauci. Have you ever met the nation's Dr. Fauci?
There are many expert clinicians in South Carolina. I am not the Dr. Fauci of South Carolina. I've never had the pleasure of meeting Dr. Fauci. That would be a real honor if that should happen someday.
Oh, okay. Well, we think you are. You don't have to think it. We think you are. Thank you all so much for joining us. Dr. Linda Bell, South Carolina State epidemiologist, Dr. Edward Simmer, SCDHEC Director, Beth Morgan, Director of Clinical Affairs and Workforce for the South Carolina Hospital Association, and co-moderators for the session today, Senator Mia McLeod and Representative Dr. Ivory Thigpen. Thank you all so much again for joining us. Thank you so much for giving all this great information. If there are any resources, links, websites that you can share with our viewing audience, please share them to the right in the private chat, and we'll make sure that information gets disseminated on social media to all of our viewers. The South Carolina Legislative Black Caucus and Prisma Health present the 2020 Minority Health Summit. Thank you all again so much for joining us. Coming up, if you want more information about COVID, the vaccine, and everything related to COVID, I invite you to join me at 2 o'clock today and 2 o'clock Wednesday, Thursday, and Friday, and every first Monday for Coping with COVID with Trey Taylor. Today, actually, Beth, your co-worker, Rosalind Goodwin, with the South Carolina Hospital Association, is going to join us to talk about the ACA vaccine, the ACA extension. And we're also going to talk with Conley Ann Ragley with the Department of Social Service about pandemic aid for foster youth. That's coming up at 2 o'clock on Facebook, Instagram, and on YouTube, Coping with COVID with Trey Taylor. Once again, on behalf of the South Carolina Legislative Black Caucus and Prisma Health, we thank you again so much for joining us for the 2021 Minority Health Summit, and encourage you to continue to post and share this information out. Such great resources, great information that we definitely want to share with the masses. Thank you again so much, and have a great afternoon. Thank you, panelists.
Hello again, 2021 Minority Health Summit participants. We hope that you enjoyed this event and were able to take valuable information back to your families and your community. Remember that the members of the South Carolina Legislative Black Caucus are always here to assist you, and you can contact us anytime. Thank you for joining us during our annual Minority Health Summit. God bless your families, our great state and country. Until next time, goodbye. Goodbye.
With our mobile vaccine program, we want to bring the vaccine to the community. We realize that there have been a lot of barriers in getting access to the vaccine, mostly through email, digital literacy. And so we want to be able to bring the vaccine out to our community, working with our community partners to get people registered and on site so that they can get vaccinated.
Our efforts are not to exactly be a mass vaccination site, but to come out to the community where we have vulnerable communities that may not have access or the ability to get to our larger sites, and really tailor to that group and bringing the vaccine to the neighborhoods.
Well, my grandmother is 95 years old, and she's been wanting to get the vaccine. And today it was a pleasure for me to bring her here so she could get the vaccine in her local community.
I learned about the vaccine from my manager of the wellness center in Eastover. I tell them, if it's going to help them, you go get it, because everybody's supposed to get it.
So we are super excited. We will have a total of 7 mobile units in our Prisma Health fleet, and that will help us to really get out to all parts of our communities so that we can bring the life-saving vaccine to everybody.
Join our team, the First Choice Fit team. We eat right, stay active, and go for our annual well visit. These 3 things help make sure you're growing up healthy and strong. Be First Choice Fit like me, Marcus Lattimore.
Madam Chair, Representative Hennigan, Representative Alexander, members of the Legislative Black Caucus, and attendees of the summit, it is my honor and privilege to bring you greetings from First Choice by Select Health of South Carolina. My name is Courtney Thompson, and I'm the Market President for First Choice by Select Health, the state's oldest and largest Medicaid managed care plan, where we have a mission of helping people get care, stay well, and build healthy communities. We wanted to thank you for your ongoing support of the Medicaid program in South Carolina. We also wanted to stand with you in your mission of addressing health equity by reducing barriers to care and addressing social determinants of health. In that spirit, we recently sponsored a new training from the March of Dimes called Breaking Through Bias in Maternal Care, which is aimed at helping develop strategies to reduce maternal bias and improve cultural equity within organizations. If you're interested, please contact Evan Owens and he'll connect you with First Choice. Thank you for your leadership and your partnership, and we very much look forward to working with you in the coming months to continue to improve health outcomes across the state of South Carolina. I hope you enjoy the summit, and thank you for the opportunity to say hello.
What if in the fight against cancer, we had a powerful new technology? A new way to find cancer so it can be treated early. Cancer strikes about 1 in 3 women and 1 in 2 men in their lifetimes in the United States. Nearly half of those cancers will be diagnosed after the cancer has spread. Only 20% of people with late-stage diagnosis will survive 5 years. Important progress has been made in essential life-saving single cancer screenings, but early detection technology only exists for a few cancers. This means most cancer diagnoses simply arrive too late. So to help current and future treatments be more effective, you first need to know you have cancer as early as possible. And at GRAIL, this is our focus: early cancer detection. GRAIL's Gallery test is a significant leap forward in the war on cancer and a breakthrough approach to cancer screening. Instead of looking for cancer one at a time, organ by organ, the Gallery test has shown the ability to take a patient's blood sample, applying the latest in technology, driven by genomics, machine learning, and large-scale clinical studies, and identify over 50 different cancers. And if one is present, predict its location with high accuracy. Equipped with this powerful information, doctors have an opportunity to step in and act decisively, potentially before cancer has a chance to spread. So it's time to complement existing screenings and start looking beyond a small number of individual cancers. Because the most important cancer is the one you or your loved one has, and beating it starts with knowing you have it. GRAIL, early detection for multiple cancers.
So it's hard to believe that about a year ago, the WHO declared COVID-19 a pandemic. Unfortunately, we've had 500,000 Americans die from this dreaded disease. We all know someone who's been touched. And I can't tell you how proud I am of the thousands of researchers who've been working 24/7 in our industry to try to change the course of this disease. And it's just remarkable to watch today as we see these first vaccines coming online, where we now have over 300 million doses that have been administered in over 110 countries. These researchers are able to see, their brothers, their sister, their mother, their father, their grandfather, their grandmother being inoculated with a life-saving vaccine. And it really has been, I think, the industry's finest hour. And as we look ahead, we think we can lever the strength of this industry to make more positive change and address dreaded diseases that are affecting our society.
There's nothing quite like a day at the beach, dinner at grandma's house, or a good game. Thankfully, the COVID-19 vaccine will help us get back to doing the things we love most. And while that's great news, it's natural to have some concerns. The COVID-19 vaccine is safe. The vaccine will not give you COVID-19, Even if you already had COVID-19, you still need the vaccine.
I know there's a lot of anxiety associated with this, but I'm confident in the FDA in making sure they have approved an effective vaccine.
Don't be afraid. It's here for our good.
The vaccine is safe, the vaccine is effective, and it gives us a means to prevent that higher risk of disease, higher risk of hospitalizations, and higher risk of death.
Join us in building community immunity. Get all the facts at prismahealth.org/19facts.
Hey, South Carolina, you can make a choice for your Medicaid health plan. Choose Healthy Blue. With Healthy Blue, your whole family is covered for free or low-cost checkups and prescriptions, plus eye exams and glasses for kids and adults. Get all this and more from a plan backed by the Cross and Shield. The choice is easy. Get Healthy Blue now at choosehealthyblue.com/SC and get more from Medicaid.
Hi, my name is Jason Carey, and I am a medical science liaison with GRAIL, a company whose mission is to detect cancer early when it can be cured. We are honored to be here today and to partner with the South Carolina Legislative Black Caucus to further our mutual effort to address health disparities. As a young company, we're excited to be a part of this exceptional community, and we're honored to be here today. In South Carolina alone, more than 10,000 residents will die of cancer in 2021. Compared to national averages, South Carolina faces a higher incidence rate of breast, lung, kidney, and other deadly cancers. The earlier that cancer is found, the higher the chance of successful treatment and survival. Yet, too often cancer goes undetected until it has progressed to an advanced stage. Using the most rigorous science, we are developing a blood-based early detection test to change the trajectory of cancer mortality. Communities of color are subject to pervasive health disparities, including cancer screenings, treatment, and incidence. Take, for example, stomach cancer. Stomach cancer does not have an available early screening test and disproportionately affects Black Americans. It is the 6th most common cause of cancer death in African American men. This is one example among many others that illustrate the burden of late-stage cancer on communities of color. By developing effective early detection technology that can easily be implemented and widely accessible by patients in all communities, we can help reduce cancer disparities. Multi-cancer early detection has demonstrated the ability to detect dozens of cancers that lack available screenings and can be done through a simple blood draw. By identifying more cancers earlier before they spread, multi-cancer early detection could be the innovative breakthrough that turns the tide in the war on cancer. Multi-cancer early detection could help close health disparity gaps through the relatively easy testing process. Once available, a primary care clinician could easily administer the test as a part of a usual checkup. That would make cancer screenings more accessible for all of us. Like those of you who are involved with the caucus, we're inspired by the community to make strides against the burden of cancer in South Carolina and across the country. We are proud to support the South Carolina Legislative Black Caucus and be a part of this community. Thank you for all of the work that you do.
Thank you for joining us for the South Carolina Legislative Black Caucus and Prisma Health 2021 Minority Health Summit. Continue to tag, post, and share this informative session. And for more information about the Minority Health Summit or the South Carolina Legislative Black Caucus, contact Devin Owens at dowens.sclbc@gmail.com. Please like and follow the South Carolina Legislative Black Caucus on Facebook, Instagram, and Twitter, and subscribe to the YouTube channel and be the first to know about upcoming events, conferences, and what's going on in the State House. On behalf of Madam Chair Patricia Hennigan, the entire SCLBC, and each sponsor, including the presenting sponsor, Prisma Health, GRAIL, Healthy Blue, Blue Choice Health Plan of South Carolina, Pharma, South Carolina Optometric Physicians Association, and First Choice by Select Health of South Carolina. Thank you again. God bless. And remember, Black health, women's health, children's health, all health matters to the South Carolina Legislative Black Caucus.